Namaskar and greetings to all the participants, faculty members, and senior experts who have joined us for this masterclass today via Zoom as well as YouTube Live. I can see a number of participants joining in, and I'm so glad to see the enthusiasm that is there amongst the young psychology aspirants to know more about the field and to identify what is in it for them. I'll start this session for today by introducing myself. My name is Kirti Maheshwari, and I'm going to be your host for today. And with that responsibility, I welcome you all to day 2 of our 3 days of workshop on careers in psychology. It's an extensive workshop that is filled in with learning and engagement. And for today, we have planned in something very important and engaging for you all. Today, we have 7 different experts joining us from areas of clinical psychology, counseling psychology, child development, criminology, sports psychology, IO psychology, as well as positive psychology. All these experts, let me tell you, they are brilliant in their professions, they're brilliant in their fields, they carry years of experience with themselves, which they have very readily accepted to share with you all today so that it becomes easier for you to plan your journeys into these respective fields. With that, I'll be introducing you to our first expert in a while. We are just waiting for her to join. She's Dr. Roma Kumar, a very senior psychologist. Let us just wait for a minute or two for Dr. Roma to join us all, and then we are ready to start the session for today. Stay tuned. Okay. Meanwhile, Dr. Roma joins us. I'll briefly let you know about who will be our expert speakers for today. We have coming in Dr. Roma Kumar from the field of clinical psychology. She's a senior psychologist. I'll be introducing her when she joins. Then, second, we have Dr. Megha Pushkarna, who's a very skilled counseling psychologist. Coming in next, we have Ms. Shalini Singh, who happens to be an organizational behavior expert. Next comes Ms. Sakshi Singla, who is a very prominent child development and parenting expert. After Sakshi ma'am, we have joining in Nanki J. Chadha, who is a sports psychologist, very renowned in her own field. And I'm sure you're going to learn a lot from her. Then we have with us Dr. Shubhra Sanyal, who happens to be the first women criminologist in India. It will be a great learning experience to have Shubhra ma'am with all of us. She carries with herself tremendous years of experience. So stay tuned. At the end, we have joining us Dr. Abha Singh, who is a positive psychology expert. So with all these experts, I'm sure it's going to be a very enriching learning experience. Stay tuned for this workshop, and we'll be introducing Dr. Roma in a while. All right. Meanwhile, Dr. Roma joins. We have a few questions coming in from our participant. One of the questions that has been asked is, if a person does an MBBS and not a PhD, what is the person called? So I would like to tell you that yesterday in a workshop we had very we had covered it in detail, that what are the kind of degree courses that you need to do in order to be an expert in psychology. However, if you are an MBBS and as part of your MBBS, after your MBBS, as part of your MD, you can take up psychology, and then you become a psychiatrist, who is basically a doctor who is eligible to prescribe medicines for any sort of mental illness or disorder. On the contrary, if you take up your bachelor's and master's in psychology and then you do your PhD, you open yourself the avenues of various positions that are taken up by psychologists. It can be in the field of academics, psychotherapy, counseling, organizational psychology, criminology, depending upon the kind of specialization that you have taken up for your master's as well as your PhD and other qualifications that you take after your master's. With that, I would also like to inform our participants that we have received multiple queries that you had sent us along with your registration forms about various fields of psychology. These queries, that they were very relevant, and we have already forwarded these queries to our experts who are joining us today. And most of these queries will be taken up by the experts as part of their sessions. The queries that will not be addressed today will be taken up tomorrow with Dr. Abha Singh in a Q&A session. So tomorrow we are having a complete 1 hour of Q&A session with Dr. Abha Singh. And if there are any other queries, you can surely let us know tomorrow. Okay. Since Dr. Roma just informed that she'll be taking a little bit of time to join, let us start with our second speaker, Dr. Megha Pushkarna. Megha ma'am, do we have you here? Am I audible to you?
Absolutely. Good evening, Kirti, and good evening, everyone who's present here. I'm Dr. Megha Pushkarna. And whenever you would want me to start, Kirti.
I would just briefly introduce you to our audience, ma'am, before I give the spotlight completely to you. Dr. Megha is a Delhi University gold medalist in sociology honors, after which she has pursued her master's from Amity University with a specialization in counseling. She carries with herself tremendous academic experience with an MSc in OB psychology from Madras University, MPhil in clinical from Vinayaka Missions University, and a PhD in counseling from IGNOU Delhi. She is an expert in preventive and promotive healthcare from Apollo Hospital, Bangalore, and is a certified in clinical hypnotherapy from California Hypnosis Institute. 13 years of experience in counseling and testing for individuals and group. Dr. Megha has also worked in the areas of adolescence, mental health and mental well-being, and geriatric depression due to chronic illnesses. She's also an associate professor at IILM University Gurugram, where she takes up really interesting courses like neuropsychology, abnormal psychology, and counseling psychology. Thank you for joining us today, ma'am, and thank you for giving us your time from your very busy schedule. We welcome you, and we hope that our participants are very excited to know more about you from the about the field of counseling psychology and what are the various avenues, how they can plan their journey in this field.
All right. Thank you so much, Kirti. Good afternoon, everyone. I'm Dr. Megha. Of course, my educational background put aside, I'm still a learner in psychology. I think the more I've been practicing in psychology, the more I've realized there is so much to learn while you're at work and the like. My journey, of course, was a switch from sociology to psychology. I did psychology in school, took a change in sociology, felt, of course, there was a lot of anthropology that could be connected to psychology. In my master's, again, I moved into psychology. And from there on, the journey has been very, very clinical. I've moved into schools, I've worked with corporates. And I somewhere feel all along my qualifications worked out for me well. My specializations worked out for me well. And from there on, of course, whatever course and syllabus I could pick up and I could work in my practical work worked for me. Counseling is basically application of how we look at mental health, we look at human development, how we look at psychological concepts, and how do we apply those principles to psychological principles of therapy and intervention to everyday problems. How can we work with people who seem to be distressed? How can we work with people for their personal growth and development? And for those concerns, counseling comes in for the core. Counseling can be used in any age group I can think of. Counseling can work with 5-year onward till about geriatric care and the like. And counseling continues to be a very, very progressive talk therapy. Counseling is something we do on a daily basis. We talk to people whom we are close to, we connect to them, and professionally we take it up as a counseling psychology as a profession. I have noticed in my field, and I'm still ongoing in my field in psychology, patients of all age group teach you something new. You cannot categorize a single concern where the client comes to you and you can categorize into a behavioral distress or a dysfunction. We as psychologists, in specific, we as counseling psychologists help our clients cope with day-to-day concerns. We help them with their emotional, physical concerns, and we help them how they can move forward with increasing their coping strategies. We look at balanced approaches when we're dealing with helping them overcome their day-to-day concerns. It could be anxiety, it could be depression, it could be self-esteem, it could be, for children, it could be their study skills. For people, working, it could be work-life balance. For people in their 40s, it could be their midlife and hormonal imbalances. You can think of any facet, any organization, any work profile, and somehow very comfortably counseling moves into there. So ideally, I personally feel my takeaway, the skills and competences which I feel as a psychologist, more as a person, frankly, that I can pass on to my, to the future psychologists that we have here. There has to be a clear communication. When you're talking to people and when you are dealing with a life per se. Be very clear in your communication. Ask when you feel you're doubtful about something, if you did not understand a term, you did not understand too many issues discussed together. Ask your client, have a clear communication. They're coming to you for clarity. If you also assume what they have in life somewhere, I think the clarity of counseling tends to get drifted. I personally feel one needs to have basic listening skills. That is something we all need to have in life. However, basic listening skills are crucial when you're trying to, pursue a career in counseling psychology. Um, More studies, more, the more you study and the more you develop skills on counseling, you are able to enhance complex problem solving skills for your clients. You're able to understand where they're coming from. You're able to appreciate diversity, and actually are able to offer them a helping hand. Analysis assessment is a very strong, is an asset for a counseling psychologist. I highly endorse assessment. So our psychometric assessment has to be very strong. Trustworthiness, the whole idea that you are a stranger to someone comes to you with a lot of doubt, self doubt, and they need to talk to someone. Somewhere the trustworthiness of keeping it to yourself and understanding and not judging, to me, becomes a very essential skill or a core competency in a psychologist. Empathy, rapport building, you're smiling, pleasing personality can go a long way for a person who's trying to fight a battle alone, can work very well. These sort of, I personally feel, skills and competencies can take you places. Rehabilitation, in the psychology of rehabilitation, counseling psychologists are welcome. In the field of education, be it school, college, they're most welcome. Clinical setup, mental health clinics, you're looking at stress management, you're looking at coaching today. So many facets, so many areas of work avenue opens up for counseling psychologists. You can go into career guidance in case you're looking for a very direct counseling. Career and vocational guidance is something which is an avenue for counseling psychologists. Definitely something which is a fact checker is any field, any specialization of counseling or psychology does not give you the right or the authority to prescribe medication. You can do a lot of work from your assessment, testing, group counseling, individual counseling, couple counseling for marital concerns. You, however, cannot prescribe medication, even on the fact you're a PhD and you have a doctor in front of your name. Nature and scope, how far can counseling psychology spread? I think as long as we have human interaction, and as long as we are people who are looking for, you were looking for a personal growth, counseling psychology will fit in. To me, because I am a counseling psychologist, I feel it's a jack of all trades. Somehow, beautifully, it fits in everywhere. People who are suffering, they need a strong helping hand. They need a hand which helps them through, not dependency. Yes, something very important. As counseling psychologists, you need to give a helping hand, but you also need to establish boundaries when it's time for you to terminate and close the session, and let your client go on their own pace to manage and cope with their lives without your dependency. So establishing boundaries is something which I personally feel is so very crucial in the area of counseling psychology. If I could just give you some tips, literally some tips of how to handle, or some tips for counseling psychology, a couple of things that I could note down is learn to relax. As a counseling psychologist, we tend to take in so much. I have taken in so much from my clients that at times I used to get drained for nothing, even though the fact my day wasn't busy. Over the years, I think after 5-6 years, I realized that I was probably internalizing a lot. So I have learned to relax. I have found my own means to do it. And I hope for the future psychologists or the ones who are interested in self-growth, find some means to relax and unwind. Secondly, let yourself off the hook. This whole self-criticism of being perfectionist and wanting to multitask can actually be a brain drain. I learned it from my own individual experience. If you're unable to handle something, be it a professional case, you can always say no. There shouldn't be any hitch or hesitation to say that I can't handle this case. I think somewhere when you say no, you're actually telling yourself it's okay if I can't handle a professional case. Number 3, name the feelings. From raising children to actually dealing with people of all age group in my session, I feel naming a feeling reduces the effort of discussing something more specific. So if you can, in your own personal life, in your friend circle, and tomorrow when you become psychologist, name the feeling is something so easy. You can do that with children also, and we can do it with ourselves also. It works very well in that manner. Uh, Fourth is something where we have to stop overloading of going into this rut of anxious thinking. We all tend to overthink, all of us do that. And I think somewhere that becomes a major habit formation of comfort zone of overthinking. So if a person has said no to you, maybe in counseling, they're not coming back to you. It's not about you. They're dealing with a lot of facade of their own emotional concerns. So maybe overthinking does not kind of work very well with counseling psychologists. And last but not the least, I feel somewhere success is not doing something for a patient. To me, I feel somewhere success of a psychologist is being someone for a person who comes to you with a lot of baggage. You may not be able to unload them with that baggage, but you may be able to give them that support that someone is there to hear them out. And I think that to me is the biggest joy in counseling psychology. So thank you so much for your time, Kirti. It was really nice of you to invite me here. Thank you. You're on mute, Kirti, sorry.
I'm so sorry. It's all our pleasure, ma'am. Thank you so much for joining us today. And I'm sure our participants have learned a lot from you in this very brief session. I wish we had more time. But yes, I'm sure the participants have learned a lot, and a lot of queries regarding what psychology is, what counseling psychology is, how is it to be a professional in the field. The participants must have really gotten an idea of the same.
I hope, and of course, if there are any queries, we'll be happy to take them. And now I think we can have Roma ma'am start her session, please.
Sure, ma'am. Thank you.
Thank you. Thank you, Kirti.
Welcome you, ma'am. With your permission, can I briefly introduce you to our participants? They are very enthusiastic and are waiting for you. I'll just briefly introduce you to them, ma'am. Dr. Roma Kumar carries with her 30 years of psychological consulting experience. 30 years, I cannot even imagine how much of knowledge she must be carrying with her right now. So she carries with her 30 years of consulting experience and is currently a psychologist with Sir Gangaram Hospital, New Delhi, and Max Hospital, Gurugram. She's also the vice chairperson at the Department of Psychiatry and Behavioral Sciences at Sir Gangaram Hospital, and the former chief child psychologist with Mom's Belief, founder director of Saksham, which is also a child and adolescent guidance clinic. She is the co-founder with emotionally.in, which is an online emotional health therapy, coaching and counseling platform that provides emotional and mental health solutions for employees via group and individual interventions. Apart from that, ma'am has a lot of expertise in training doctors and psychologists in psychometric testing, neuropsychological evaluations, psychoeducational assessments, relationship counseling, child and adolescent evaluations, parenting coaching, grief and bereavement counseling. Ma'am, even if I take the entire workshop, it will be very difficult for me to summarize your 30 years of experience. So why not we transfer the spotlight to you and we listen from you as to what is it to be a clinical psychologist? How can the participants here, they can explore their journey in this area? What is the kind of qualifications they need? What are the kind of skills they have to develop? So I'm sure they have a lot of questions, and your session, they're waiting very well for your session.
Thank you so much, Kirti. And you said so many things. I'm a very, very down-to-earth person. Worked a lot in my life, and I think the hard work is what has got me where I am today. And good afternoon to you, everybody, and good afternoon, Abha ma'am. I'm so happy to be here once again with you. Thank you so much for getting me here. All right. So before I begin what clinical psychology is all about, I think I should go back to the point where I began my career. I began my career where I was traveling. I was doing my master's in psychology, and I was traveling to see my dad, who was posted in as a DDMS at one core, which is at Mathura, and I was sitting in the train. And there was this very nice, fashionable lady who was sitting next to me, and she started talking to me and she said, what do you do? So I said, I'm pursuing psychology. And she just had some conversation. And immediately after that, she said, okay, this is my card. And I think I should employ you and come to my office, which is in Defense Colony in Delhi. And I looked at her face like, really? I know nothing in psychology. In those times, in 1987, we had no internships. We had absolutely no idea on what psychology was all about. I mean, we were still learning, we were still doing things. And when I reached my dad, I told him that I met this funny lady, and then she said this, and he says, I think you should go. So I said, I'm still studying. I haven't given my master's second year exam as yet. And this is January, and the exam is going to be sometime in May or June. So he says, no, you should just go. I went to this office and she just immediately said, okay, here's a child. Why don't you do an IQ assessment on this child? And she gave me a Stanford BNA Hindi version test. I had never seen it in my life. Hindi version तो कभी जिंदगी में नहीं देखा था. पढ़ाई कर रहे थे तो मैं तो बिल्कुल, I was like, what am I supposed to do? What testing? I have no parent. I have nobody. कहाँ से history? What? She just said, okay, this is the child and you have to evaluate. I had no understanding. From there begins my journey. That's where I began. As a psychologist, and my salary to go in the first month was 200 rupees a month, and that's from where I began. I worked in that place for 4 years, and before that, actually, while in my bachelor's, I was picked up by one of the organizations to come and do voluntary work with children with disabilities right from first year of graduation. So here, to the younger population and the younger aspiring psychologists, I would say psychology is a lot of hard work. Psychology is a lot of patience, excessive tolerance. And as Megha was saying, that you need patience, you need to be a good listener. I completely agree with you that if you're not a good listener, you're never going to understand what your client is going to tell you ever. Apart from being that good listening skill, I think you need to question yourself somewhere. What is it that I want to do in my life in psychology? What is my aim? I mean, I hear the younger generation talk of, I want to get into criminal psychology. आधे से ज़्यादा लोग तो सिर्फ criminal psychology की बात करते हैं. 12वीं करी नहीं, अभी criminal psychology कर लेते हैं. So, come with that thought. What do you want? Do you want to do something for your country? You know that your country is like a capital with depression and anxiety, and look at the uncertain times that we have gone through right now. What is it that as an aspiring psychologist would you want to do for the country, and for yourself, and do something where you can get help and remove that stigma which is so deeply attached to everybody while you have to talk about mental health or emotional health. We began Emotionally, which is an online therapy program, in March 2020, right at the time when the lockdown began. And although we wanted to begin it much later, but it was going on for almost 6 months and we decided to do it. We haven't seen a day without meeting the partners every day, 9:30 a.m. every day. There's a Zoom call with all the partners to decide what is the next move. We all know currently it is a hybrid mode that we are going to be following. Most of us were not trained with virtual counseling, virtual therapy. And here we are all, I can see so many aspiring psychologists writing, talking, reels, Instagram posts, everything suddenly from, writing on psychology. I would say, good, but hang in there, Again, let's not confuse people. People come with their genuine problems, and you have to have that open mindset to listen to that problem. So when I sit on a hospital chair, I'm not sitting there to just see some healthy issues in counseling or some healthy areas. I'm mostly doing crisis intervention, because at a hospital setup, you will be doing crisis intervention, you will be networking, you will be listening, you'll be doing so many other things. You'll be doing assessments, you'll be doing counseling, you'll be doing workshops, you'll be doing many things, and also training a lot of young doctors also how to pick up individuals with mental health and emotional health issues. So that's something that we all need to think about. And also, let's not run away from the fact that, okay, the college or the university says so many hours of internship, बस हमने internship करने आनी है, साथ में फोन लेके texting करनी है, वहां कुछ हो रहा है, we're not paying attention to what is happening. I think as young aspiring psychologists, learn, watch, observe, ask questions. For people like us, we had very few opportunities to ask questions. We had to really go and hunt for information to find out more, and even while this lockdown, I wasn't hesitant to do any courses. And when I would go into any platform, I mean, if I saw the younger crowd and they would ask me, ma'am, why have you come here? And I would say, I'm still wanting to learn. I'm still wanting to share whatever I have, I want to share. I'm not immortal over here. I want to share with the younger population to learn more techniques, So while in the hospital practice, it is a very tough practice when you sit on that chair. When somebody comes in, walks in with a problem, and sometimes that problem is huge, sometimes that problem is almost similar to the life experiences that you've gone through. So you have to have that barrier where you don't cross that barrier and practice ethically, that the younger generation definitely needs to learn that and do a lot of research. Something that we are lacking here is research, which is ethical research. Talk about real life problems. Talk about what is happening to a family. What is happening to the children. The children who have got orphaned now with the second wave, it is unimaginable. I remember while the second wave was going on, and one of the corporates, very well-known corporates, got in touch with me and said, we want you to do a virtual counseling session at the ICU. I had never done it. I had not done it in this country. I have been trained with palliative care and end of life, but I have never done this. And they said, we want to really save this person. He's lost his father, he's lost his mother, he's lost his wife, and he has a very small child. And the child has also lost maternal grandparents within a period of 20 days. And this is the only person who's there now. We want you to save him. And this was like, I wanted to do everything that I could. And I remember doing those sessions twice in a day, talking to this person, and his oxygen levels from a very low level went up to a very high level, very optimistic. But one day, of course, the call came that he's no more there. And I was talking to the child also. And unfortunately, with certain laws in our country, the child was taken away by the child department in Gurgaon, and the child felt completely lost. Look at where we as psychologists now need to, voice ourselves that what are we doing to these younger children? Who is going to take care of them? They are orphaned, right? And so let's work on the stigma, which is majorly there, the barriers. And when a client comes to you, they will definitely say, आप तो सिर्फ बात ही करते हैं, आप तो सिर्फ सुनते हैं, शायद आप बात भी नहीं कर रहे, आप सुन ही रहे हैं, सुनने के पैसे लोगे आप. ये तो मेरे को अक्सर बहुत बारी सुनने को आया, आप सिर्फ हमारी बात सुनते हैं और आप पैसे लेते हैं. ठीक है. दूसरी चीज सुनने में आती है, आपका थेरेपी सेशन बहुत महंगा है. बहुत चीजें ऐसे सुनने में आती है. डोंट गेट एंग्री. The client is coming from some thought. Your idea is to help this person. So I always work with a sliding scale. I never do one scale. I always do a sliding scale. Talk to the family, talk to everybody. Also, I would say that now it is imperative that after you do your master's, if you have to get into clinical psychology, you have to do your MPhil in clinical psychology, especially in India. Abroad, of course, the PsyD is the one that is there. But in India, you definitely need to do MPhil, right? It's not like us where we got trained in various areas, not just in this country, but other countries also. And we came back and we began. So I remember beginning 3 special schools in and around New Delhi, NCR, where I was taking my entire team to those schools outside the city to develop those schools. And today those schools are doing very, very well, you know. But at the end of the day, what did I get from there? I got this soul satisfaction that I was able to do something for those people where even the government was not able to reach out to them. And that satisfaction, I think, it is something which is soul satisfying, nothing more than that. Yes, we all want money, but we don't need to be living in that thought कि clinical psychology करके पैसा बहुत कम मिल रहा है. And then the younger generation is always, you know, I've seen mental health people sitting and fighting amongst themselves. Stop doing that. We're mental health people. We're supposed to fix situations. We're supposed to help people. Stop getting agitated amongst ourselves. Let's learn to, you know, work among diverse populations. Let's try and respect each other, because if you have to respect the client, you need to respect each other also. And when in clinical psychology, you have to work with all the medical health professionals. You have to learn to deal with the inpatient department. And there are sometimes very serious patients who are there. So you have to learn to do that. I know that I have not given up on anything. I always take up challenges. And if I get stuck, I have my mentors. I will go back, talk to them. I work among peer group. So I will speak to my peers and I will talk to them to find out a solution and not give up. I think I can keep on talking, but I know we have limited time. I would love to answer any specific question if it is there.
Thank you, ma'am. We have a very mixed audience today. They are students from schools, graduate programs, postgraduate, and some of them are even pursuing their MPhil and PhD. So it's a very mixed crowd. But there are certain very relevant questions that these participants had sent us earlier. One such question is that, you know, when a student is usually pursuing their bachelor's and they take up an internship, that is internship in a hospital, how do you actually, during your internship experience and after that internship experience, how do you realize, or what are the cues that help you realize that yes, you can take up clinical psychology tomorrow as a profession, because it can get heavy for some people a lot of times. If I take my personal experience, my first internship in clinical psychology, after 2 months, I decided that I'm not cut out for this position. But maybe 3 years later, 4 years later, I thought that yes, now I'm mature enough to handle it. So, you know, how do you keep on evaluating this through this journey? Can you tell us something about that?
So me and my team, we are very well understanding this part. So what we do is when we get grade 12, we get graduates, we get masters, or we get MPhil PhDs for any internships. Our programs are all different. Right. So for the 12th class, we'll be giving them more exposure to understanding the fields of psychology and what is it that we do. So we give them more exposure to understanding, especially during the virtual internship sessions. We've given them a lot of that understanding. I think children should ask more questions. You know, you should have more questions to ask. And please explore the other fields also, and not just get stuck with clinical or counseling. Don't get stuck there, right? I know people want to do criminal. It's very fascinating, criminal psychology, but we have a lot now who are wanting to do veterinary psychology. There are lots of others who are wanting to do sports psychology, but we don't have many training programs there. So they're hunting for all of that. So I think psychology is all about exploring, understanding, researching. You learn more. So ask more questions. You know, when you are interning, ask more questions and don't just stick to one hospital setup. Hospital setup is, limited in your exposure. We only give you a lot of mental health disorders or mental illnesses probably, but you need to see a larger population, which is a normal, healthy population and has some areas of conflict which have not been resolved, or there's some anxiety and there's some depression, some panic attack happening, and you need to see that population also. You need to see a population where couples are engaged in poor communication skills. So you need to see an NGO where what the kinds of work an NGO is doing. So expose yourself to various stimuli, expose yourself, only then you will pick up which area is probably going to be somewhere that you want to do, and maybe you decide to do something now, and maybe, as you said, Preeti, that another 3 years, 4 years, you want to do something else. Go and do it. Nobody stops you from doing that. Just go and do it. Explore and experiment.
Absolutely, ma'am. I think it's an insight for me as well. That yes, as you mature into the field, you should be open to the various possibilities that psychology can offer you, and that is how you can actually make a vivid professional out of yourself. I have another question from you, ma'am. We are seeing a spike in depression, anxiety, and other mental health issues. If we look at India, it's increasing at an alarming rate. So, do you think that there is an emerging scope for preventive mental health care for the psychologist, and what can they do
Absolutely.
for preventive mental health care?
I completely agree. I think like what you are talking, and creating more awareness and sensitization about mental health areas, about the emotional health areas, about well-being, I think that's what we need to do. There has to be a collective response towards that. Each one of us needs to pitch in to create more awareness on what mental health and emotional health issues are. And if I can go to a dental surgeon without any stigma, if I can go to a gastroenterologist or a dermatologist without any stigma, why have I got this in my head that I have to have a stigma to go to a mental health expert or to a counselor? It all begins from childhood. It all begins from home. It begins there. Arey, तेरे को क्या problem? तेरे को तो problem है तो psychologist के पास ले जाएंगे. Parents would be threatening their children that you have this issue, so you need a psychologist. And I would always say, I think each one of us needs a therapist. We must have a therapist like we have a physician. So where's the harm? When we have a general physician, we should be having a therapist with whom you can go and talk non-biased, non-judged, and just go and vent out your things. The moment you vent out, you are going to feel much better. And the problem is that we do not allow ourselves to vent out. We are so ashamed of talking of our issues. Let's stop doing that. Let's, in small, groups, start talking about it, start addressing these areas, and believe you me, it's going to get better and better and better, right? And we all face adversities and challenges in our lives, but we can't give up. So we have to take on those challenges and adversities and move forward.
Absolutely, ma'am. Thank you so much for this enlightening session. There are so many queries that that the students still have. I would like to request Abha ma'am to please say a few words. Abha ma'am, do we have you here?
Yes, she's there.
Yeah, good evening, Dr. Roma.
Good evening. Good evening.
And all my colleagues and all dear participants. I'm really thankful to Dr. Roma to give the valuable insight which you have given in the field of psychology. And I'm very happy, Dr. Roma, that you conveyed more information non-clinical. And that's the challenge today. How to prevent that population, normal, healthy population, not to become abnormal. That's a major challenge we are facing now. Dr. Megha Pushkarna also highlighted that how we need to listen and solve that problem. So this event is really to make students, prospective students, current students, and practicing psychologists aware how we can make this field of psychology more user friendly for everyone. As you rightly mentioned, Dr. Roma, I agree 100% with you that we don't hesitate to go to any medical doctors. But when it comes to mental health, people have a stigma till date. And God knows, after post-pandemic, we all know that the problems has multiplied. So how do we address? So I think we'll have other speakers also speaking on the areas of psychology. But I'm very thankful that we just call you and you are available for us. So once again, on behalf of Department of Psychology and IILM fraternity, I'm so thankful to you. Thank you for your valuable insight.
Thank you.
Takeaway
Thank you
is
so much.
takeaway is that explore, experiment, and be an expert. That's what is takeaway from your talk. And for my participants, this is what I have learned, and I'm sure you must have learned, and many questions would be posed to Kirti to take it further in the next session, or any question if we have for Dr. Roma, I think she can address. Kirti, if we have questions for Dr. Roma. I was seeing a lot of questions coming in the chat. So just check if we can take the advantage of being Dr. Roma Kumar here in the virtual presence.
Absolutely, ma'am. We want to take the complete advantage of having ma'am here right now. I've taken up all the relevant questions that we have received in the chat. However, there are other questions from participants that are about other fields of psychology. I'll be happy to take them when we have other experts.
Thank you so much, and thank you, Abha ma'am.
I have, Kirti, you missed that, maybe, because there's a lot of things coming on the screen. People are asking on psychiatry, that how many years psychiatry is something which I think you can explain the difference between psychiatrist and clinical psychologist and psychologist of different areas, because they are going to listen to the areas of psychology, different areas of psychologist. So I would request you to just give a difference between psychiatrist and clinical psychologist and psychologist and different areas of psychologist. Over to you.
Thank you, Abha ma'am. So a psychiatrist is a person who's gone through an MBBS degree, like any other doctor, MBBS degree, and thereafter he or she pursues 2 to 3 years of, mental health work, which is study in the field of mental health, where a psychiatrist can prescribe medication and also probably give some kind of therapy if they go in for some other further training also. Now, psychiatrists are also going through super specializations. They do their MBBS, they do their DM or MD in psychiatry, and then they do further fellowships or something for child and adolescent psychiatry or family counseling psychiatry, all those kinds of psychiatry. So you have people who are now getting into super specialization in the same way like psychology field is also growing. So a psychiatrist is a person mainly giving medication, and mainly also giving all kinds of therapeutic procedures within the inpatient department or in the operation theaters. They are the people who are giving that also when there is a mental health issue. Whereas a clinical psychologist will go through a bachelor's in psychology, a master's in psychology, an MPhil in clinical psychology, and then probably pursue a PhD. But MPhil will give you the license to practice in India with clinical psychology. And there are few colleges, and there are more colleges which have now come in for training yourself with MPhil degree in psychology. Whereas a psychotherapist is probably a counseling psychologist, or a psychotherapist is again going in for specialization after master's or PhD, whether in CBT area or dialectical therapy or narrative therapy or any other therapy, and starts practicing those therapeutic procedures. So that's a counseling psychologist. And educational psychologist is a person who will probably pursue after bachelor's, master's, super specialize in doing school psychology, where doing a lot of testing for children with disabilities or children with learning disabilities and how to include them in a school setup. So that is what the job of the school psychologist is. But mainly the job of the psychologist involves a lot of creating awareness, a lot of sensitization, a lot of parenting workshops, teacher training workshops, a lot of awareness basically, because we are still struggling with small areas where we're not understanding that how important is mental health, and how important it is even for males to consider mental health issues and not just women, although women are the one who go more for mental health area help. And another area, then you have psychologists who are marriage therapists or couple counselors. They again go in for further specialization. So that this is how we specialize for various fields. But a psychiatrist is basically a person who is giving medication. In our country, psychologists are not allowed to prescribe any medication. There are a few areas outside our country where some areas they can prescribe medication. Unfortunately, in our country, we've had lots of instances where younger psychologists have been writing some medications, and I would say, please don't do that. That is very unethical. Your license might go away because of that.
And recent what Parliament has approved the bill, if you are aware.
Behavioral psychology, where they will be getting license to practice also. Counselors will also get a license to practice. They will be also registered for that.
All health and allied sciences profession.
Yeah.
Thank you, Roma ji. Thank you.
Thank you. Thank you, everybody. Thank you so much. I will have to leave because I have to still be in the hospital. I would be leaving. Thank you so much.
Thank you, ma'am. Thank you for your valuable time.
Thank you. Thank you.
I hope the session with Dr. Roma must have cleared a lot of confusions that our participants have had about clinical psychology. We have tried taking up majority of your questions. If there are any more questions left about clinical psychology, please keep them reserved for our Q&A session that we have planned for tomorrow. Meanwhile, we have our expert from the field of organizational behavior joining us.
Hi, Kirti. Hi, everybody. What an august audience I get to be a part of.
One second, ma'am. I'll just bring you to the spotlight so that our audience can see us. Thank you for joining us today, ma'am. Her name is Ms. Shalini Singh, and with your permission, I'll just take a little bit of time to introduce you to our audience.
Sure, go ahead.
Ms. Shalini Singh is an alumna of the prestigious Lady Shri Ram College with a specialization in organizational behavior psychology. She carries with herself a 10.5 years of HR experience and is currently employed with one of the world's largest banking and financial services organizations. Shalini is globally certified senior HR professional from the Society of Human Resource Management. She has an academic bent of mind and holds double masters, an MA in psychology from University of Delhi and a PGDM in HR from IMT Ghaziabad. Interestingly, she was also the only person who was nominated consecutively in the year 2005 and 2006 by the Ministry of Education, Government of India, towards UK Commonwealth Scholarship Program to pursue PhD in psychology. She is highly passionate about driving the diversity and equity and inclusion agenda and works majorly for women empowerment. She has also been a regular speaker in industry forums and conferences and has many publications to her credit. We welcome you, ma'am, and we are sure that with your diverse experience, our participants will now be able to learn more about the field of organizational behavior, what kind of career opportunities they can have in that area, and how can they build themselves as a professional in the field.
Thank you for that wonderful introduction, Kirti, and you've been very supportive throughout. And I'm absolutely delighted to be a part of this August panel today, addressing a newer batch of students who are joining in. So first of all, congratulations on having made the decision of getting into the field of psychology, choosing that as an option. I think you've done one of the most beautiful experiences that's going to follow through once you've gotten into this subject. You're going to be looked at as the elite people who can read faces and read minds and all of that. Throughout your any interaction with anybody, doesn't matter what level of the organization you're. The moment you say, I'm a psychology student, I've done this, people are just going to look up to you and say, oh, wow, I wish I would have done that. I really wanted to do that. And all of those things, I'm sure my co-panelists agree with that. We hear that all the time. And of course, the ones who are doctorate in this field and all, we huge respect for them. They've really through and through. They are the ones who call themselves the psychologists. We are really the ones who are practicing, even like the kind of students of psychology who still practice at different fields. So I actually had a couple of slides, Kirti, and if that's okay for me to share with the students, I would look forward to do that.
Sure, ma'am, please.
Thank you so much. Welcome once again, all of you, and we're absolutely looking forward to an interactive conversation, because monologues are just so boring, and we'll know we're talking about humans here, and thankfully there's no technology that we're talking, so humans can interact, and we look forward to your inputs. We are, even if I minus the 6-8 of us on the panel, I'm sure there's so many of us out there listening, and you could just unmute yourself, speak, or if that's not available, then just put in your observations, thoughts in the chat. It'll actually be a nice dialogue that we could look to engage in for the next 20 minutes, the time that's been allotted to me. Okay, give me a moment. I'm going to be sharing my screen. And what I'm going to be sharing about is really my experience as an organizational psychologist, somebody who's been practicing that at the workplace. How is it different? What does it mean? What does it actually mean to be practicing psychology at work? What does HR have to do with psychology, and why should somebody who's done psychology should get into human resources? What does that mean? How can we add value to the organization? And how are we different from somebody who's done a management course and joining? Any thoughts, any questions before I get started? I'm sure it being an orientation batch, there just must be so much of information download that must be happening. But it would just be great to start with a few questions if any of you would want to share that on the chat option that's available. I'll give about 30 seconds till that those questions, and I'm going to look up to Kirti to keep pointing it out in case I missed that, but I'm going to go ahead with the sliders that's there. Okay, so let's maybe start off with this. Familiar, all of us? I absolutely love this thing, and anybody who's taken and read psychology in class 11th and 12th would relate to what's there on the screen. Do you see anything on the screen? Initially, I'll tell you why, what I used to ask initially, and what is it, why am I saying it's a batch of psychology students? Some of you might have done psychology in your 11th and 12th, and for a few of you, it just might be so new. What is it that you can see on your screen? Okay.
There are some responses that we are having, ma'am. Some say it's just all, some say it's a girl and a woman. A girl. There are the responses coming in.
Shivangi, thank you. Girl and a woman. Can you annotate? I mean, can you tell me which one is the girl? I mean, is it a young girl, a woman, a young woman, middle-aged woman? Optical illusion? Oh, we don't want psychology students to be answering those questions. Let's give chance to somebody who's not done that. A lady, Jal. Is that your name, Jal? Beautiful. A young lady, Akshita. A young girl looking back. Beautiful, Uditi. Thank you so much. So you can see the young girl with her eyelashes and a small nose, and somebody who's looking back and wearing a nice headgear on top of her. So on top of a young girl. Look at the perspectives. You're all young girls, so then the perspective that we get to see is a young girl and an old woman looking down. Ranisha, I hope you're not a psychology student, but if that's your perception, fantastic. A young lady. Thank you, Shrestha. This is great stuff. Okay, now I'm sure a lot of us who actually got to see the young girl, and there's lots who actually saw an old woman looking, a sad, rich, and a young woman. How interesting is that conversation? I mean, that observation. Fancy young girl looking the other way. Oh, beautiful expressions. I love the way you're actually putting it all out there in the chat. Right, so let me just go on to the next slide. A side face of a lady, princess with a crown. Beautiful, Mehek, you are right, Yogeshwari, that was a very nice way of putting it out there. So now with the outline, it's clear. There is this face that we're looking at with an old lady with a long chin and a young girl with eyelashes looking onto the other side. Nothing is wrong. Whatever you see is your perspective, essentially. And it's a great conversation starter, and that's how we try and understand what are you thinking through. I'll tell you an interesting thing that happened when we were doing this as an optical illusion in class. I just couldn't figure out the old woman. And I was like, where is the old woman? And my classmates then told me, oh, look at that nose, and then look at that mouth, and then look at the chin. And then finally I was like, oh yeah, that's how it's in life as well. We are so attuned to look at a certain way that another perspective or a different or a diverse view gets very difficult for us to understand or even appreciate another person's perspective. So that is something that is a great start when you're actually exploring something, maybe sitting in your class, discussing with your teachers. And I've been very fortunate to study with some of the fabulous psychology teachers way back when I was doing my graduation. We used to have a lot of discussions in class where our professors used to really push us to think and beyond, and then question them, because it would then challenge them to come up with those answers. And I'm sure when you start doing that with your professors, they're also going to encourage you and challenge you to think more and talk about it. I see Kashish Chauhan has raised a hand. Is there a question you want to ask, Kashish? Is there an option to unmute Kirti in this session?
I would request the participant to put down any question in the Q&A section in order to maintain the decorum of the workshop.
Yeah, that's okay. Maybe it was just the slip of. But thanks, Kashish. No worries. That's just a nice way to say hi. Great. So maybe we move on to the next slide, and let's see, what do we have in here? So what is, after you've had your interesting optical illusion, and for a few of you, it might just be a great start saying, wow, this is psychology. I really want to do it. And if that's what I've been able to get you to do, I think my work is done for the day. But I just continue with, what does it mean to apply psychology at work? And for the last decade and a half that I've been working with the organizations, I worked with various foreign banks, consulting and banking. And right now I work with HSBC, which is Hong Kong and Shanghai Banking Corporation, based out of London. And I'm situated in Gurgaon. And that's what we look at. I lead a team of HR generalists, and they are people who've done their management and studying. And what is it that HR gets us to do? And how is psychology valuable to the field of HR? So I'll take a minute or two and walk you through that. So let me see. Yep. So here, very quickly, to let you know, this is what very broadly, I mean, it's a huge, diverse topic, human resources in itself, and organizational behavior in that is something that will take care of learning and development, where you actually apply a lot of psychology that I'd learned. I've been very fortunate to have people who've encouraged me to go ahead and apply psychology at work. So if you're talking about motivation, we're talking about developing senior leaders for future, that's the area. What motivates people? How do you have those challenging conversations? That's the learning and development part of it. So they are called learner, leaders, experiential learning, all of that. Then there is another department which in human resources, which does employee relations. Employee relations is something which has to do with, you wear the detective hat, and all you're trying to do is to find out who said what to whom, was there a conflict, has there been a fraud, does it, if somebody is feeling harassed, the manager is not supportive, then you actually get into the details of understanding human psyche, why that happened, what could you do to resolve the conflict. Would you actually go ahead and do a HR facilitated discussion to make sure people see the other person's perspective, just as we were looking at the old lady and the new lady, as in the old lady and the new woman. That's the field that you actually need to look at in employee relations. It's a very demanding branch of HR. and very niche and very specialized. Psychology is really helpful when we are actually looking at the other person, investigating, confronting, topping, that's a field where I think there are difficult conversations that you need to actually conduct. So there's special training given to these HR professionals. And if you have psychology as a background, it hugely helps you, because you're just not doing for the sake of doing it, but you understand human relationships, behavior, why they did what they did. And I lead that ER team. So that is something that I can let you know that as a personal experience, I have had amazing support from the subject to do well in my job. And then comes HR operations too, the leaves, the salary payouts, the advances and all of this. Those are the major departments within HR. And what's organizational psychology? Psychology, it's actually industrial or organizational psychologists focus on the behavior of employees at work. They apply psychological principles, research methods to improve overall work environment, including performance, communication, professional satisfaction, and all of those, anything that has to do with human behavior and output and productivity. That's where the psychologists come into play. Every time we have an introduction, there's a senior leader who's coming to talk to us. I feel so proud to say that, I have been a psychology student, and every day at work, I get this element because we're dealing with humans. And what better than a field of HR to actually put this at work? I do have my fellow panelists who are either sports psychologists, child psychologists. We heard Dr. Roma, who was there earlier. I mean, it's amazing to see what all different branches of psychology brings in, but the subject in itself is so vast that I think an entire lifetime is less to read and get to know about it in so much detail. I'll take a pause, but there's another, and I want to leave you with the next slide and maybe a couple of suggestions on books while you'd want to know more about psychology and understand. Mehak, I see you put in a question saying how much does internship help in pursuing psychology in future? Oh yes, absolutely. I think it's just not psychology, Mehak, but essentially any work that you're getting to. If you had an opportunity to do internship, which is where you get to observe and train yourself to prepare well when you're actually getting into full-time job, which is very, very helpful. How long? It really depends on what breaks do you get, which organizations do you get to do these internships. It could be from a month to 3 months to 6 months, paid stipends, and it is hugely helpful when you actually full-time get into doing the job. I hope I was able to answer your question, Mehak. Okay, Gaurangi, we have another question coming from you. You had a psychology background, so how did you get in HR? Oh, beautiful question. Thank you so much, Gaurangi. I love that question, and every time it's posed to me, I feel really nice about answering it. Yes, I had psychology as a background. And the first year in LSR was about getting to know the subject, and then a very nice heart-to-heart conversation with our teachers, with our professors to understand, what do you think I could do better? Where am I as a personality suited to do more? And those conversations helped me take a decision to take up organizational psychology as my specialization, which is further than it enabled me to get into HR, because HR is directly related to organizational psychology, and then that's where you get to go and apply it. So, Gaurangi, I hope that was an attempt to give your answer. Yogeshwari Singh, what is the work of a psychologist in a bank? Oh, beautiful. I mean, I want to take this question back with me, and thank you for asking, Yogeshwari. Bank is just like any other workplace. Banking has its front-end side, which is, when you go to a SBI and ICICI banks, then you'd actually go put your money, take your, use the locker facility, the check and all of that. That's the front end that you see. The back end is who takes care of these people who are attending to the customers, we are the people, HR, at the back end who are doing this work. Their salary, their driving, their motivations, their promotions, everything is on the HR team. And that HR team could have people from the management background, could have people as psychologists. And the future looks like is so much more bent towards having organizational psychologists at work who can actually apply those principles to improve the frontline, the people who are actually catering to the customers. Okay, let me know if that answers your question, Yogeshwari. And Kirti, you'll have to keep me true to the time. Do let me know how much more do I have.
We have time, ma'am. Please, you can continue with your presentation. We have time.
Perfect. So, okay, I've received the thank yous, and please keep pouring in your questions. That's the way I'd love my sessions to be. I'm just not used to a monologue. And Shivangi, okay, ma'am, what can a psychologist do to motivate others in a workplace? Good question. You'll have to study psychology for that for 3 years, along with your teachers, have all of those discussions. And then there's a lot of things. There are theories of motivation that we read, the various theories and the leadership theories and all of that combined together. It's very important to understand what motivates whom, and every individual has a different motivation or a driver. For some it could be money, for some the others it could be leadership positions, the third it could be a particular area of work that they want to get to. Somebody doesn't want to be a cashier, somebody wants to be the branch manager. So what is it that's exciting for anybody? Once you understand what motivates the other person, you can actually develop programs to make sure that they're given that space to work and grow up the ladder. Shivangi, did I answer that question for you? I see Dr. Megha typing, so I'm so looking forward to what's coming up. Okay, that's an answer that she's trying to give to Shivangi. Cool, that's great. So another question's come up. Let's see. Jal says, how do you hold the employee at work if they genuinely don't like the job? Again, a fabulous question. I think you guys already have an amazing inclination to do this subject. So I think great choice by actually choosing to be here today. And yes, Jal, to your question, how do you hold employees at work if they're not interested? Well, there are a lot of reasons, as I said. There are reasons why people take up a particular role. There's somebody who's absolutely passionate. I will fall in that bracket. I love what I do, and I love putting psychology back to my work. But if there could be somebody who may have wanted to do something else and have gotten to do something. So then you have your conversations with them. That's the learning and developing department of HR, which gets into that conversation to say, okay, you don't like this, fine. What is it that you like? And what can we do to get you there? So maybe if there's another department, like the credit department, and somebody who is at another part wants to get there, what are the trainings that's required? And then there are organizations that have these trainings available. You pretty much get them to attend those trainings, and you become they become good at what they do. And then when there is an internal job posting, it's called IJPs internally, you apply to that role and you land that job. So that's a way to take care of people who might not like their current role. There's so many opportunities within an organization to change your job if you're not comfortable with one area.
Excuse me, Shalini, if I can come in here. I was just taking questions from Q&A, and I thought, I thought you were taking it from chat, and I would really request you if you could just answer this for us. Ma'am, what can a psychologist do to motivate others in a workplace? Please go ahead, please.
Okay, I'm sorry, I didn't get who was speaking.
I'm Dr. Megha this side. I was writing for students in Q&A. I thought you were picking up questions from the chat. My apologies. I would really like you to answer this for us. What can a psychologist do to motivate others in a workplace? This is in the Q&A. So
yes, please. I did answer that question as we were speaking to understand what is it that drives a person at workplace. And then as a follow-up to that question, I answered Jal's question. But Shivangi, I don't know whether it really answered the question that you had asked. Or would you want me to repeat some pointers from there? I'll leave that to you, Shivangi. And oh, wow, which one should I take? There are there in Q&As and there are there in chat. So let me just go to Mehek. Like we motivate other people, there will be a time when we are only out of motivation. How can we as psychologists, psychiatrists can do to motivate ourselves? Okay, so question number 1 to all of you, and I'll not take any other questions, but how is a psychologist different from a psychiatrist? I know Kirti is smiling, everybody else is smiling, but here this question is to the students. I need the answers before I can answer that question. Who is a psychologist and who's a psychiatrist? They give meds? Who give meds? Yogeshwari? You don't want to type psychologist. It's such a long word, and there is a chance that you might just misspell it also. Okay, Yogeshwari, the question's for you. Psychologists can't give meds, but psychiatrists can. Very good, Gaurangi. I think if psychiatrists can prescribe Shrishta medicines to their clients where a psychologist can't. Perfect. That is very, very good. Psychiatrist is an MBBS doctor who's trained in the field of psychology. Psychologists have a degree in psychology. Oh, perfect. You guys know it. So you can refer to your peers who have all the answers. Psychiatrists hold a medical degree. Absolutely. So thank you. Now that you have answered that question, as promised, I will have to go back to the question. Like we motivate other people, there will be a time when we are out of motivation. Oh, absolutely. There are times that you're feeling absolutely out and down and out, and you don't want to get back to work. So take a chill pill, take a break, move out, go. I mean, I have my kids, I spend time with them, watch movie, read a book, and I have a couple of book suggestions that I'll leave with you. And I think you need to just disconnect with what you're doing to reconnect with the larger world, with your life. And the moment you come back with what you do and what you love, I think you'll connect instantly. And all of us need that break, whether you are students or professionals or anybody. So Mehak, that's for you. Uditi, is it appropriate to share mental health diagnosis with other employees? No, absolutely not. And is workplace bullying a common occurrence? Workplace bullying happens. And as I had covered in my description of what the HR team does, that's employee relations part of it, which takes care of these bullying and harassment and all of that. Yes, it does happen. I can't say it's common, but it does happen. We are dealing with humans. Shivangi, thank you for that confirmation. And compassion and fatigue. Okay. Thank you, Jal. I didn't get what that was for, but great. Just being mindful of the time, I'm going to run and go on to my last slide, which is Alice in Wonderland. How many of you have read the book, seen the movie, and know about the cat and Alice and how she gets lost? And if you've not, please go to Netflix, wherever, look at the movie, watch the movie, read the book. It'll not take too long. I have my 10-year-old and my 5-year-old kids. So great, Disha, you mentioned you've seen and read both. And what do we get from there? So I'm going to ask this question to Disha. I hope you're out there. So ready, 1, 2, 3. Lewis Carroll has written Alice in Wonderland. And that's how the book looks like. It's a children's classic that all of us somewhere or the other have read. So let me see what happens. And here, when Alice is absolutely lost and she's walking, she looks at the cat, the Cheshire cat, and she says, would you tell me, please, which way I ought to go from here? So because she's lost, and obviously she wants some kind of a guidance. So this huge cat looks at Alice and smiles and says, that depends a good deal on where you want to get to. Very, very right. So if all of you are Alice, then you want to know which way do you want to get to. And that's why you're sitting here. And we are maybe the cats who are trying to tell you that that's the way you need to go to. But you need to know where you want to get to. So that is a very, very important learning from that. Alice says, I don't much care where. So essentially, she just wants to get somewhere, but she doesn't know where. The cat then says, it then doesn't matter which way you go. So if you don't know where you're going, does it really matter? So long as I get somewhere, says Alice. Obviously, you need to give an explanation. I want to get somewhere. So yeah, tell me, where should I go? And I think this last line that the cat actually tells Alice is something that stayed for me for a very long time, and I still use it. Oh, you're sure to do that, said the cat. If only you walk long enough. So if you've chosen a path to be in this psychology department, you want to read, you want to be a psychologist, doesn't matter what specialization you take up eventually. you need to stick around with the subject long enough to see what you can get out of it. So I think that's my very favorite slide. With that, I think I'll just leave you with a couple of these books that you could read on your whenever you get the time. One is Emotional Agility, and it's one of my favorite authors, Dr. Susan David. And something from a workplace point of view, these have good examples. The Adaptive Space by Michael Arena. So those are the books available wherever. Dr. Neha, oh, good to see you. You are here. Great. Do you have a question for me, Dr. Neha? I see you raised your hand. That's right. If you're speaking on mute, and if you're not speaking, then we can actually, I can stop sharing my screen.
I think Dr. Neha Jain will be joining us again as a panelist. There's some, I think, connectivity issue there. But as far as your presentation and your session is concerned, ma'am, I think it has resolved a lot of queries. Most of the questions you have already taken up, so I really don't have any questions left. But yes, it has surely given the participants a direction as to how they can proceed. As to how they can make their way into the field of OB and HR. Thank you so much, ma'am. I will now invite Dr. Abha to say a few words.
Thank you, Kirti. Thank you, G. I don't know your name, but I like that compliment. Thank you so much. Dr. Neha, nice to have you.
Hello, Shalini. How are you?
Very, very well. I had a great interactive session with such wonderful students who are around. It was a pleasure, and with Kirti moderating the session, it was fantastic.
Good to see you after so long, Shalini. And your talk was really interesting. I was not able to join, but I was listening to it from the live video session. So very interesting, Shalini, and I'm sure the students, many doubts have been cleared by your talk today. The talk was very interesting. You almost touched all the important topics of OB today. So, especially if we talk about these present times, the times of pandemic. So OB has also changed to a large extent. The role of leaders, the role of, concepts like motivation, how to motivate an employee in these difficult times. It's been a challenge to almost all organizations. So, it was really interesting to hear you, to in fact, hear about your view on various topics such as human resource management, employee engagement, and I love your Alice example. That was really nice. That was actually, very interesting. And I think students had a lot of questions also. I was listening. I had some connectivity issue. So on and off, I was listening to you. So I think there were a lot of questions which were being asked, right, Kriti?
Yes, ma'am, absolutely.
Yeah, very interesting. Thank you so much, Shalini. It was
It's
great
been
to
an
have you with
pleasure.
us.
Absolutely. Thank you, Dr. Neha, and thanks, Kirti, and thank you everybody on the panel and lovely students. I'll see you where I see you. I'm there on LinkedIn. Feel free to connect, and all the best with the decision you've made. Thank you, and I'll take your leave.
Thank you so much,
ma'am. Thank you, Shalini. Thank you.
Okay, dear participants, I'm sure a lot of your queries are getting answered one by one. I see that you're very enthusiastic to know more and learn more about the different fields of psychology. And we are glad that we have been able to provide you this opportunity through IILM University to help you resolve these queries. We have our next expert with us. Her name is Ms. Sakshi Singla. Ma'am, do we have you here?
I'm right here, Kirti.
Thank you for joining in, ma'am. Ms. Sakshi Singla is a child and family coach with a specialized MSc in child development and family studies. She is a gender equality parenting coach. How interesting that is. So yes, Sakshi ma'am is a gender equality parenting coach, and she has authored 29 books in K-12 domain. Those of you who do not know what a K-12 domain is, it's kindergarten to 12th grade domain. She has 19 plus years of experience in the education consultancy and is currently also pursuing her PhD from IILM University in the field of positive psychology and emotional intelligence. She specializes in one-to-one counseling and works on helping parents to be their best versions by first resolving their own unresolved issues and healing past wounds. She also runs various parenting online courses on calm parenting, gender equal parenting, resilience building, sex education, etc., and also does one-to-one coaching and mentoring for adolescents and youth. What is very interesting about the work that you have done over the years, ma'am, that I personally found interesting is, and something that our last panelist also talked about, you have stayed with one field of psychology for a very long time and you have made the most out of it. And there is still a lot of work that I'm sure you're hoping to do. So how do you really identify this niche? Along with your session, if you can also talk to our participants about how or what was your process through which you have identified this niche for yourself, and what kind of motivation helped you stay in this niche and make the most out of it. We welcome you, ma'am. The stage is all yours.
Thank you so much, Kirti. This has been such an enlightening session for me as well. And like some of the panelists told us before, was that this field, how much ever we learn, I think we will probably never be masters of. But that is what psychology is for you. Kirti, thank you for introducing me and speaking so kindly about me. But yes, I've been able to stay put in the niche that I have now been working for over 19 years. And where is it coming from? It's coming from a purpose which I think I found in this work when I was first in college. Then I started working with the subjects in child development and psychology. I got my aha moment then. And my aha moment was coming from where? It was coming from the fact that I realized through my work and research and the learning that I got from my college was that it seems like there are about more than 90% of the problems that this world has can be rooted back to the kind of parenting, the kind of teaching styles, and the environment a child grows up in. It's a very profound statement that I'm making here, but I'm saying that with a lot of confidence because a lot of my work in parenting, counseling, education consultancy, also writing for children, training teachers and training parents, I feel this is one thing if we could correct, or if we could understand from whatever psychology understanding that we are doing in our fields, whatever field it is, the world is going to change. Because what happens is that, and you will see that yourself when I speak about it aloud, is that the generational patterns that we carry as people or as our parents been carrying from their parents and how we turn out to be do come from the hassles or the challenges that we face. So the challenges that our parents have faced, they would parent accordingly. And sometimes when we are not able to resolve those unresolved issues, they carry on as a generational pattern. Generational patterns are also looked at when there are bigger challenges, they're generational curses, which goes out to say that parenting in 1970s, 1920s, and 2020 has to be different. Why? Because the world has changed. The world has changed. The world is so different today. But what we are doing in parenting is still a long way to go. Hence, I feel the field of psychology can really fill the gap. And that's what I've been trying to do. That's how I've stayed on to the field, because whatever I've done till date and whatever I intend to do and wherever my learning I want to take, I want to just keep staying here, because I feel if I'm able to bring a change in the kind of parenting that parents bring to their children, the whole world is going to change. And a lot of these problems I see coming from gender inequality that we've been really stuck with, not just in our country, but globally forever. Again, these problems you will see in parenting, where we are maybe bringing up our girls now as princesses and our boys as people who are going to always be providers. How does psychology bridge this gap? My background is psychology. I've worked in the field of psychology. I'm learning in the field of psychology because that is what has trained me to understand what, why, how, and how long back a behavior goes to, is where I put psychology in place of whatever parenting work I have done. Also, how do you get to do what I'm doing in parenting, or if you're interested in work which is related to this field, you could either do a MSc in Human Development and Childhood Studies, BA Psychology, and doing various parenting, NLP courses or otherwise parenting courses also gives you an option to practice. Like Dr. Roma was saying, that for counseling, you now require an MPhil, so you would probably need to go for that. MA Psychology, and then picking up your specialization in child psychology, child development, and courses along with it is another option to take. Lots of programs are out there in this field, but we've got very few people working in this field. So we've got parenting people, but sadly, the parenting people in this industry are more parenting bloggers who have young children and who've been doing a lot of work on social media. They put out a lot of parenting content, but my question to them always is that till the time you've not seen either all the seasons of parenting, so you haven't parented an infant and taken the infant to be an adult, or you've studied psychology through your college courses, you've taken it further, you are researching in it, there is no way that you can learn what good enough parenting is. Hence, there are many, many, many people required in this field. Some of the niches that are part of parenting or child development niches also I thought I'll talk about here. You could take specialized courses in adolescent counseling, child counseling. You can become a neuro-linguistic practitioner. You could work in inclusive education consulting. A lot of psychology-based people do very well with children books authoring, curriculum development. So publishing industry has also a requirement which we've not been thinking about a lot, but I've done some work there. So I've written curriculum books, and I've also written some books for special needs children. That's where your psychology marries the need quite well. Then there are other places where I feel, and I really would want psychology students to pick those fields up, is being authentic parenting bloggers, because a lot of general public or mothers are following parenting bloggers. So if there are psychology people in that industry, many of them, I feel, will not be misled. Then there are lots of communities like Mom Presso, Baby Chakra, Parent Tune. These are all big parent communities who have a huge requirement of child psychologists and psychologists in general. Children counseling, curriculum development based on a psychological understanding of children, career counseling, school counseling, psychometric testing in career counseling centers. Another place where I think we need a lot more people is adolescent counseling. I think Dr. Roma does that in her, I think in whichever space where she works and emotionally, but there are very few adolescent counselors out there. That's another stage of life where a lot of problems stem up from. An adolescent or youth is someone who is very keen to take risks. If not channelized well, they can be misguided very quickly as well. So a lot of your substance abuse, a lot of issues that we see in this world do start from a place where the young adolescents were either misguided or they did not know enough. And more than that, it's not the adolescent, but it's the parents who didn't know how to handle or understand the stages of adolescence. So they didn't understand the psychology of who an adolescent is, how the brain of an adolescent is different, what are their special needs. The parents take the door slams and the eye rolls. They get very offended with things like that. But most of these behaviors are behaviors which are natural. And if our children don't do that, or our adolescents don't do that, they will not become their own independent, unique persons. So the need for, I think, child psychology or parenting work is something where I would love to see a lot more people coming in. And I think I'd leave it here if anybody's got some questions. There are tips and tricks which were very beautifully told by Dr. Megha. So all psychology students, if you can just keep those in mind, any field of psychology, counseling or otherwise, I think requires that kind of empathy. And thank you so much, Kirti.
Thank you so much, ma'am. That was a very enlightening session. And it does tell us that, sometimes we become too engaged with the fields of psychology that we often see at the top. And we forget that, over the time, it is good to, find out your niche, be an expert in that niche, stay with it, as Shalini ma'am also mentioned, and work in that area. So yes, indeed. And I absolutely love what you said about that either you need to be a psychologist or you need to see all seasons of parenting in order to be a child development expert. Absolutely. There are a lot of people out there who are not really qualified, but they promote themselves as psychologists. So as a community, we should be aware of such practices. We should be totally aware of what kind of licensing, certification, and qualification we need to practice. So thank you so much, Sakshi ma'am. That was a very enlightening session. I'm sure the students, if they have any questions, they can write it down in the Q&A section. We have just a few minutes before our next expert comes in.
Thank you so much, Kirti. I guess lots of questions are still brimming in the minds of our young people here because, like you said, we've always been talking about, or they've already basically have known about the counseling psychology or clinical psychology. But like all the other experts have talked about psychology in a way that just seems that any field today requires psychology. That's what we say about computers today. Can't have an office or any industry which does not have an IT hub. I think we also need a psychologist in every industry possible, may it be corporates, banks, like what Shalini was saying, or the hospitals, or what we do. I guess there is a lot of need out there. So we are hoping that everybody here does take the call to pick up some field of psychology or the other. They are not going to be, they'll be pretty happy by the end of it because they'll also end up understanding themselves very well. So thank you so much. Thank you all the students here who've been very patient in listening to us.
Thank you so much, ma'am. Thank you for your valuable time. I will now invite our next guest speaker, Ms. Nanki Chadha. Do we have you here, ma'am?
Yes, she's right.
Yes, I'm here.
Welcome you, ma'am. Ms. Nanki Chadha is a sports psychologist. She is an internationally certified sports and performance psychologist under the British Psychological Society. She has completed her undergraduate degree in psychology from the University of Delhi, and her passion for sports was something that encouraged her to pursue the field of sports psychology. And she completed a master's from Loughborough University in 2016. I'm sorry. Currently, she is also nearing the completion of a doctoral degree at Staffordshire University, United Kingdom. She is also primarily certified practitioner. I'm so sorry.
Nanki, we are very pleased to have you here. And we welcome you. And this is the area which, as a psychologist, I felt that nobody is talking about. And more medals we are seeing every day from Tokyo, and we all hear. And the need of this profession goes higher, in the field of psychology and sports psychology. So I would like also you to talk to my students and prospective students that this is a very upcoming field, and now every sports person should have their personal psychologist, and that's how I'm visualizing this field to be. And about your profile, I think I'm really impressed by your background, and I came to know from Sakshi about you. And I'm so thankful that you took your precious and valuable time for us and give us a guidance and inspiration to why not study the sports psychology. That's what I look at from your profile and understand. Over to you, Kirti.
Thank you, ma'am. Thank you for the lovely introduction, and thank you for having me on the panel firstly. Ma'am already mentioned that at the highest level, and we can talk about Olympics as an example in the current scenario, where most athletes are at par with each other in terms of their physical ability, technical and tactical aspects of the sport. But I personally feel there's that one element that really differentiates the good from the best. And that's where sports psychology comes into the picture. And my journey as a sports psychologist started, I would say, about 5-6 years ago. But in terms of psychology, the importance of psychology, I would say, in sports started at a very young age. And I would start by really telling you all a personal story of how I was actually motivated to get into the field, which might be relatable for a lot of you as well. So I started my sport journey at the age of 8 when I started playing competitive tennis. And although it started as a hobby, I was extremely passionate about the sport. And it was just something I used to get away from studies. But soon I started competing in the sport. And that's where the challenges really started. I started hating the sport because of the stress and the anxiety that I used to feel. And in a few years' time, I left that and I started playing golf at the age of 13. And soon from the tennis court, the pressure went onto the greens of the golf course. I played golf for approximately 10 years and played at the national level. And the more I started competing at the national level and a few international events, I started crumbling under pressure. And by crumbling, I would say I hated competing. I used to get severe anxiety where I used to actually feel sick and get butterflies in my stomach. And I started comparing myself to my co-players, saying, okay, we are the same level technically, physically we are at the same level, but what's differentiating me from them? And that happened to be the mind. The mental strength, I would say, which is often within the sports psychology or the sports field termed as mental toughness. So I personally felt I was not mentally tough enough to compete at that level. And my journey started of finding a sports psychologist in the country. Unfortunately, I could not find a qualified sports psychologist within the country who could help me with these challenges. And alongside, I was doing my undergrad in psychology, and I took a sabbatical year after that and thought, what do I want to do in my career? Do I really want to pursue sports when I don't enjoy competing and I don't have the support, or where somebody can actually help me compete at an level, like at a professional level? So I thought, why not I combine my passion for sports and psychology and go do a master's in sports psychology, a specialization. But I would say that was also not without challenges because of the courses not available in the country. Now we still have a few courses, universities offering sports psychology as courses, but back then there was not even one university that had the specialization. So that's when I kind of went to the UK and did my master's in sports psychology. Going there was a completely different experience in terms, I always thought sports psychology would be all about performance, helping athletes deal with performance. But actually, I explored or kind of got to know about a new aspect of sports psychology, which is well-being, which we often forget. Now, by well-being, I will give you some recent examples. With the Olympics and even before the Olympics, we have a lot of athletes coming out and talking about depression, anxiety of leaving sport. And that's more to do with the well-being aspect as an athlete. Now, by well-being aspect would be the mental health, not the performance, not about winning your matches, your gold medals, but it's all about, are you really enjoying the sport that you compete in? Are you getting proper sleep, nutrition? So that's all aspect of the well-being, which we often ignore. We often see athletes as a commodity and that they should either succeed or perish, and that mediocrity is unacceptable within the society. And I would say especially in India, the field is very niche and in its infancy. And over the years, it is growing because I would say in 2 years, we have more and more professional athletes, Indian professional athletes who have come out and spoken about mental health in sport, which has started the conversation around sports psychology in the country. So we had Virat Kohli, we had Robin Uthappa, we had a few more. We had Sachin Tendulkar. We had prominent athletes who have actually come out and spoken about mental health. And so I hope, currently I don't, the field is growing, but I don't think we have enough qualified sports psychologists in the country who've gone and done a master's and come back and practicing. So I think that's one very important thing. Also in India, we don't have a governing body which regulates the practice of sports psychology. I think where other fields of psychology are concerned, they are still a bit more structured in the country, but where sports psychology is concerned, we are lacking structure. But I feel that's even more interesting and challenging because we can start something from the basic, but on an ethical grounds. So I feel we need more and more sports psychologists in the country. And talking about performance, like I'm a sports and performance psychologist. Of course, sports is my area of interest and specialization. But when I talk about performance, if we relate, performance is there in all aspects of our life. Even as students, we are constantly performing to get better grades. So if we look from that aspect, sports and our day-to-day journey is quite similar. Yeah, so basically that was my journey as a sports psychologist. And if anyone has specific questions about how to go about the field, what are the different options, I'll be more than happy to answer those questions.
Thank you, ma'am. We have the queries coming in from students, but meanwhile, can you tell us about some good universities that are here in India from where they can pursue a course in sports psychology? Because possibly not all of us are, not all of the participants can be capable of going to abroad.
Yeah. That's a very good question, Kirti, and I am doing my research here as well. So I Unfortunately, I don't know of one university which kind of specializes only in sports psychology, but there are a few universities that have a module. So that's not a specialization, but under sports science, you will get to learn a little about sports psychology. So unfortunately, we don't have a master's degree in the country. But like you said, a very valid point that not all students can go abroad. Then I think the options can be distance learning. So there are a few universities in the UK which allow a distance learning master's, if that's an option a lot of students might be keen for.
Okay, and as far as a person can pursue a master's maybe through distant learning or by attending a proper course. But what about the journey? After the master's, in a country where you do not see a lot of sports psychologists, you do not see a lot of scope. So a person who's just come out of their master's can be there standing clueless as to what should be the next step. Because you come from a background of sports and you have been into the field for a long time now, can you tell us what can be the next step after master's in sports psychology?
Just a second, Kirti. I have to answer that university name. Since I've been in academia for a long time, I want to take that question of students asking which university. University, I think if you have heard Central University of Rajasthan, they have a school of sports science. They have programs in sports psychology. So you can look for the degree or UG, PG program. Now Indian universities are framing the sports science department, as Nanki was saying. But yes, many universities, like our university also, we have a sports psychology module. We have a course. Students can select the elective. And this is how, if students come more, we start creating the program. For 1 or 2 students, we cannot run the program. That's where the universities are facing problems. So let me tell you both sides. But the central government university, Central University of Rajasthan, they have a department of sports psychology. So they have programs. So look into that. This is one university I came across in a psychology group. So that's what I wanted to inform. Over to you, Nanki.
Well, thank you, ma'am. That was some good information for me as well, since I'm exploring the field in India now. So I have one question, Disha. So which university did you pursue your master's from? So I went to Loughborough University, Disha, which is in the UK. It's up north. It's about an hour and a half from main London. So Kirti, coming back to your question, after a master's in sports psychology, and that's a very valid question, because I am getting a lot of queries from students that we've done a master's, what next? Of course, it is overwhelming, and in terms of coming back and what opportunities do students have. So like I said, the field is growing in India now, and the conversation has started, especially after the Olympics. So more and more organizations are hiring sports psychologists now. So whether it's the government organizations or even private organizations like Go Sports Foundation, you've got Olympic Gold Quest. So they are hiring qualified sports psychologists as a part of their multidisciplinary team. There can be research. So I think as an independent researcher, you can enter the field if you're keen in research, and can have your own independent practice as a consultant as well. So those are some of the options after a master's that students can look into.
Okay, ma'am. Thank you for answering that. Another question that is very important to understand here is, you come with a background of sports. You have been a sports person for a long time, and then you decided that let me, bring in my academics to this field, and, let me utilize all those years of hard work done on the field, and you pursued sports psychology like that. But let's assume that I'm a person who has not ever played a single sport. If I'm a person like that, can I still pursue sports psychology, or will there be certain limitations that I may encounter if I've never been a sports person?
You can absolutely pursue a master's in sports psychology. I don't think you have to play a sport to pursue the field. You just need to be passionate about sports, and from my own personal experience, what I personally feel is sometimes not having played a specific sport or too many sports, it actually can work in your advantage. And why I'm saying that is often when I have athletes coming and I having played the sport, I need to be very particular of not bringing my own personal experiences forefront. So I have to I constantly have that battle that, okay, every individual's experiences are different, but if they are kind of talking to me about a particular experience specifically in golf, for me, I need to be wary and not bring my personal experiences on the table. So somewhere I feel not having played a sport can be an advantage here, where you're just focusing on their issues and not worried about your own personal experiences hampering the sessions.
I would like to add what you're saying. With my experience of one of my PhD scholar, who was doing on athletes and why India does not have so many gold medals. So, but he was not a player, and he is guiding many golfers, to the national level, and he's doing all kind of sports, and that's not a hurdle I see in him, because as you rightly mentioned, if you're passionate, you'll get to know many things about this area. We can't be everything for that area which you want to be. But if you're expert in that area, you can really help any professional, whatever field you are. So since Nanki is in a growing stage, I can say, and if we meet her after 10 years, she will not say the same thing. Am I right, Nanki? So
yeah, absolutely. And it's been a learning lesson for me as well.
So I have seen people who are working as a psychologist. Maybe one day we will call Kirti, those who are working vigorously in India, and with a lot of scientific data, evidence data we have on this, to help students know how we can grow in this field. And this is more vibrant field today, seeing the Olympic medal which we have in our country now.
Yeah, absolutely.
Absolutely, ma'am. Thank you for your input. Thank you so much, Nanki ma'am, for joining us today. Thank you for giving us your valuable time. Students, you still have 2 minutes. If you have any query, we have ma'am here. Make the most out of it. I'm sure they're thinking a lot because sports psychology is something which is as fascinating as criminal psychology, and there is a lot that the participants are still exploring about it. But yes, ma'am, thank you so much. Thank you so much for your insights today.
Thank you.
And one takeaway from her talk, I must tell all students, combine your passion with psychology. Very well said, Nanki. I really like that. Combine your passion with psychology and you will be a great psychologist. Thank you.
Thank you.
Our next speaker is a very eminent personality in the field of psychology. She is Dr. Shubhra Sanyal. She is regarded as India's first women criminologist. Dr. Sanyal will be joining us in another 2 to 3 minutes. Meanwhile, if students, you have any queries, you can always put it down into the Q&A section. Post Dr. Sanyal, we'll have our expert, Dr. Abha Singh, coming in, and we can surely take those question and answers there. While I see in the Q&A section, there is a question that is related to the session on child and adolescent psychology. It's asking that what is the scope of child and adolescent psychology in abroad? Sakshi ma'am, if you're available, can you please take that question for Disha Jaiswal?
Sure. Disha, the scope abroad is huge. Even bigger than what we have here, because they have very clearly worked on the niche of child psychology, adolescent psychology. They also work with youth as a separate stage of life, because being a youth is Someone who is from the age 15 to 24 is what we term as youth. And adolescents are, it's starting earlier now, but 10 to 19 years is the stage of adolescence that we talk about. Like I said, so many issues that go into our adulthood do start from adolescence, do start from judgment, do start from places where the parents don't understand how the brains of adolescents are changing. It is a field which is fast growing here as well, but abroad there is a very, very huge scope. If you're thinking of doing something abroad, I think you'll be pretty happy to see the kind of jobs that you'll find there.
I believe, Sakshi ma'am, what you said is completely true, but I also believe that a lot of times when we talk about these niche fields in psychology, whether it is sports or whether it's child or parenting coaching, it is that the professionals in the field need to do a lot of advocacy, because not a lot of people know about it. Maybe people in tier 1 still know about it, but if you go deep down to tier 2, tier 3 cities, a lot of people do not know about these fields. So there's a lot of advocacy that needs to go in. Can you tell the students, the participants, something about it, and how it's after all it's a field, it's a career, and you need to market yourself also. How do you do that? How do you tell that yes, this is important, and yes, you there is a scope for it? Sometimes you have to create it as well. Can you tell us something on that?
Very, very interestingly questioned, Kirti. That's what we are doing here. I guess what IILM is doing, which many other colleges probably haven't done, is to put panelists, so many different panelists coming from so many different niches here to talk about it. Because yes, you're right, the education is required. Like I said, we were also somewhere not very clear about the fact that we need licenses, or how does counseling or parenting or any other work can be done in India, which is why a lot of people don't know about it. Like I said, in parenting, anybody who has 2 beautiful children who can be dressed up in beautiful clothes, and somebody can just Google and check what are the 2 things that you do for your children to make them successful, is easy content to put, which is why I think, yes, what you're saying as advocacy, we really, really need to do that quite a lot. When it comes to parenting, I try and do that. But when it comes to other niches, IILM does that quite well. We've been trying to speak to our students a lot on all the subjects that we are talking about. Like me personally, for example, I've been taking gender studies. I do a lot of gender equality advocacy through my work as well. And it is something like what you just said, that if you see inequality and you become aware, you can't unsee it. Now that we've spoken about sports psychology and we've spoken about various fields, all the students out here, I don't think can unsee these niches anymore. So I think we are doing well. Thanks to you, Kirti, who's put across all of us here to bring that advocacy to at least these students who are here, who I hope will take it to many other hundreds of students. But thank you so much for the platform.
Thank you so much, ma'am. Thank you for that wonderful answer. It does help you understand, not just as a professional in the field, but also as a person who may sometimes need a professional from the field. It's important to understand and differentiate between who is genuine, who is going to give you the right information, who is going to give you the right guidance, and who is not going to do that. So it's very important that I think we as a community come together sometimes, and we advocate about it, that this is how you need to differentiate between what is genuine and what is not genuine. Any thoughts here from Dr. Megha Pushkarna or Dr. Abha Singh? Most welcomed.
I It was a wonderful session where we had such fantastic opinions being brought through. Nanki, I really liked your suggestion. You know, we do interviews for people who are looking for either forensic nowadays or want to go into sports psychology. Certainly, counseling and clinical are taking a backseat. No offense to that. But you know, I really liked, and I'm actually going to quote you and your statement that it's actually nice at times not to be from. Not to come from a personal experience. Frankly, I've never heard someone say that. You're very brave to say that, you know. I haven't heard anyone say that. And it's so true because by the end of the day, you know, there are times, Nanki, when, you know, we're doing counseling and I do feel I'm not there because I do tend to internalize a lot at times. And I have realized I need to unhook myself because I don't need to be perfect in my own garb of PhD and I'm supposed to know everything. So you're so brave. I'll just follow you. So thanks to you, you really got you got something together. And Sakshi ma'am, you know, she said something so brilliant. Everybody kind of takes parenting so for granted because it's so natural. But you know, there are hooks we tend to, as concerns we put through. So bringing everybody together works wonders for all of us. So thank you for a wonderful session. I learned a lot too. Thank you.
Thank you, ma'am. We have our most awaited expert, Dr. Shubhra Sanyal. She has just joined us. We welcome you, ma'am, on behalf of the IILM University. Is my voice audible, ma'am?
It is.
Thank you for joining us today, ma'am. With your permission, I would like to briefly introduce you to our audience.
Can you hear us, ma'am? Subra ma'am? Good afternoon.
Is ma'am on mute?
No, I think she was trying to, let us see.
We'll just wait for a minute.
Maybe some technical problem.
Yeah. Can you hear me?
Yeah.
We can hear you, ma'am. We welcome you to this workshop. Thank you so much for your valuable time. With your permission, I would like to briefly introduce you to our audience.
Yeah, sure. Welcome. Come along.
She's Dr. Shubhra Sanyal, and she is regarded, as I mentioned it earlier, as India's first women criminologist. Dating back to her journey, she started her career in 1973 as a lecturer in Lucknow, where she also joined the Jail Officers Training Institute, and later in 1984 became a faculty member with NICFS, from where she superannuated in 2006 as a senior reader. During this period, she has worked in different capacities as a trainer, as a head of division, as a teacher, consultant, and in different organizations. She has played these amazing roles. Counseling parents and children has been a part and parcel of her profession. And with that, she has also written a book for NCERT on drugs and adolescence. And this book has been titled as Save Your Children. Dr. Sanyal has taught students, counselors, social workers, senior functionaries of criminal justice system in long-term and short-term courses in this Institute on Drugs and the Addictive Behavior, and is very fond of delivering lectures on profiles of drug addicts, juvenile delinquency, psychological consequences of child abuse, and the treatment as well as rehabilitation programs. She has been associated with a number of renowned institutions, namely National Institute of Criminology and Forensic Science, in Home Ministry, Ministry of Personnel and Grievance, United Nations Development Program, Ministry of Social Welfare, and Government Observation Homes. She has authored multiple books, multiple articles, and has also participated in the SAARC conferences in Pakistan in 1998 as leader of the Indian delegation, Media and Drug Abuse. She was also there in the second SAIRC conference in India in 1990. Dr. Sanyal is a recipient of prestigious awards in the area of criminology and has recently been recognized as a Women Achiever for outstanding work in criminal psychology. Ma'am, what you have done with your career is something that we all inspire to do with ours. And I don't think so I can sum up your journey. So why not I let you speak to our participants and tell them about how this entire journey started. Tell them about the field of criminology, forensic psychology, something that fascinates every psychology student. But most of the time, we have very little knowledge about what it is in reality. If you can please enlighten us, our participants, about it, ma'am.
Thank you for your.
Ma'am, heartiest welcome to IILM.
Thank you, Abha. I was just trying to tell them that my travel was not complete. They did not mention that I was in Amity for years as visiting professor, and I got the opportunity of meeting you, meeting such lovable students that I nurture and nourish the ideas even today. And you were the one who was behind giving me that award of Achiever in Criminal Psychology. So that my travel was not complete. That's what I was wanting to tell them. Nice to see you on this.
We heartily welcome, and
thank you.
I'm thankful for your valuable time, and my team is looking forward to listen to you eagerly, and many students are waiting for your insights. Over to you.
Thank you, Abha. And I was telling Dr. Abha that I'm always there with you, and we can have from here long journey, organizing many seminars and sessions henceforth. So talking about career psychology, let me first say that when we talk of this word psychology, it has an intrinsic relationship with sociology, with philosophy, everywhere the relationship is, even with economics, culture, to the extent that, thinking that an individual, why is he failing? Why is he under stress? Why is he that he's not able to achieve his goals? That is also part of psychology. Because they also, one understands or fails to understand, let me say in the other words, as to what are his goals, what are his achievements. So what I'm trying to convey before I go into career psychology, that psychology itself has an intrinsic relationship with every discipline on earth. Not only that, psychology has a very, very, again, not intrinsic, it is an intricate and introspective relationship with a very human being who is studying psychology. Now, therefore, the manifestation of psychology into new vistas, new avenues are so immense that only thing is that we need to understand the potential of that psychology, need to understand how psychology can spread and expand out even in the media. People who are using the media to give us certain information, you just looked at them, the anchors who are doing it, you just see their psychology, how they are trying to impress and convey. So psychology has got, I won't say all this, more than all disciplines, but yes, you can say it is a link, it is a pivot, it is a bridge which tries to put in all disciplines together and gives one individual a whole entity, a whole sum picture. Because a successful person, to my knowledge, is one who has a good knowledge of psychology of his own self. Before I go to further things, let me say that you students of psychology who are studying psychology, you try to take the ABC of psychology to its fullest length, and you will find that it opens up the doors and channels for you. In every case, you will say, oh, I can be there also. I could have done this also. And you will be a successful adventurer, moving with your profession. Because there is no dead end. There is no closed tunnel. Always at the end of the tunnel, there's a glimmer of light, and that is psychology. So you see, I start with this thing, if you say today in India, outside India, for psychology is held with high respect, high importance, everywhere, but India also. psychology with the fast life that we are going, with the modernity of life that we are having, with the working women going out, fast type of thing. Psychology is playing a very, very detrimental role in maintaining the houses, in maintaining, stopping people from breaking up, and giving counseling in schools, career counseling, vocational counseling, you mention anything. The counselors are there who are trying to guide, show the way for a successful life. Now, in my case, let me tell you that I was not one who was going for psychology. I had no, at the age of 23, 24, when I was doing my post-graduation from Lucknow, you see, I had knowledge of, or I was more interested to do geography because I graduated from geography and I wanted to pursue geography because that time geography had no new avenue. And I want to be a woman who could go into the meteorological department, study weather, and be a very renowned person. But today I feel that if I had gone there, I would have been dead end as somebody there and no future. But today, even now, as you mentioned, Shreya mentioned about my travels are still continuing. And I don't think so it will end till I end. The traveling is going on. And that is nothing else, the psychology in me. So I come back to my thing that when I wanted to go for post-graduation in geography, this sometimes we have to leave certain things in God's hand. And I was told by Lucknow University that we have no course of geography in post-graduation. So I had to take psychology. Thanks to my teachers who created interest in me in psychology. And I studied clinical psychology, in which abnormal psychology was one of the papers. And from there onwards, I started venturing out and out and out. And then, as you mentioned in my career, that I was 1 year in Isabella Tobin College as lecturer in psychology, I started something in me. We talk of conscious, subconscious, unconscious. Something in me said, who am I? And this is what I have been talking to my police officers, to the judicial correction, that first and foremost, you correct yourself as who you are. Then only you'll be able to fix your goals, fix your activities. Even when you're scolding anybody, your subordinates, and trying to use very, abusive words, or let's say not abusive, but in not proper words, get into yourself and say, who am I? Who I am doing it? And this is all part of psychology. So when I started teaching the graduate students, I started understanding then only, though minutely, the issues, the stresses, the muttering. Probably they are not liking my lecture. They want to move away. They are finding the lecture very mundane. They may not be liking any other teacher. They want to go out and sit in the canteen. These sort of things are, part of student life. So I started, from then onwards, I said, okay, let me play with games with my psychology. I started narrating stories to them. Some were hypothetical, some were factual, and they started coming to my class thinking, yeah, we can hear some stories from her, some psychology. And that created interest in them in psychology. And for me also, it was something new for me, how to engage them in my lecture. But till then, friends, I never knew that there is something else waiting for me. I only knew that I will be moving in this college and, one day I'll become professor and I'll retire. But something else was destined. And after a year, I left and joined Jail Officers Training Institute. And from here, my career took a new turn. And it can happen with you all also, provided you understand that you are sitting on an atom bomb. That psychology can be a very good bomb for you. It can explode and take you anywhere, or it can also, leave your side. Now, what happened here? That when I went into that, I was as a, girl then only, because I joined JTS, Jail Officers Training Institute, at the age of 25, 26. And there were jail officers who were fit to be my fathers and grandfathers. So I was totally nervous. And twice I thought I'll leave the job. But something within me, I had no guide, I had no mentor, I had no counselor. Even my university teachers said, okay, leave, we'll get you some other job. But something in me said, okay, let's study these officers. First, let me know what they're trying to convey. Because each officer thought they know more than me. And they tried to subdue me. Anything I went to say, they used to laugh, sneer. Then I started friends. Honestly speaking, I'm sharing my things. How I entered into this criminal psychology. That I used to spend late nights studying abnormal psychology, criminal psychology. There were hardly any books on criminal psychology in the library. I went on studying. And after studying, I used to stand in the class. And what I used to do, I used to play a game. Once again, I used to say, okay, we'll do a little psychological exercise. Because I wanted them to feel that I'm more powerful than you. And I have a weapon in my hand. And that is assessment of an individual self. So I said, पहले तो हम देखते हैं कि आप 4 words में, 4 sentences में आप लिखिए अपने बारे में मैं कौन हूँ. So they used to wonder that this is a quiz she's playing. Then I used to say, after 4 distinct points, now you say what you exactly feel are shortcomings in. You know, after playing this game, then we used to gradually move into my concept of learning criminal. That is from where I started, the learning criminal. And I started telling them that every behavior is a conditioned behavior. The way a child gets conditioned to a particular behavior, similarly, criminal behavior is not coming from heaven. Neither a child is born with that criminal tendency. It is that which he picks up and learns from the environment. This is what I learned. This is what my psychology told me. And this is how I went on expanding on that and studying all theories of crime and criminology, day in and day out, to the extent that they got convinced that she cannot be taken for granted. She knows more than us. And I went ahead. Now comes the second phase, I think. Teaching in the class was not sufficient for me, or I was not understanding. It was all bookish. Fortunately, what happened, I was, I had to travel even in Lucknow and outside Lucknow with the police jail officers. I was the only girl and they were all males at the age of 50, 45, 50. I'm traveling with them to the prisons of UP and beyond and seeing the thing. Then also, I was not able to understand, these people, and I felt a little disgust, let me admit today, that I used to feel disgusted. How come these people can murder their wife? How come these people are so hollow, so criminal? They look so, hefty. They used to look, stony. There was no emotion in them. So I used to feel that these people should stay behind bars. Honestly speaking, that was my first thought. Because I was first interacting in my life with criminals in prisons in the country. And there was a feeling of disgust. I never wanted to go near them. But I could see their eyes were piercing me through, as if to say, you dare. And I used to say, I will not dare, not come near you. So I used to just take a customary walk and come away. What changed my views was when I started studying female criminals. When I was told by my guide, not my guide exactly, it was brought to me by one of the prison officers who was superintendent and my director. He said, why don't you start your doctorate from here? You have a very good opportunity. You have a sample, which you will not get anywhere. And that is female criminals. To my surprise, I took it, yes. But within me, I was having a fear. How will I come across, sit with them? Female criminals. Again came to my mind, how can a woman kill her husband? How can a woman kill her own children? Are they not abnormal? That abnormal psychology clicked in me, that these people definitely have some sort of psychosomatic disorder. They reminded me, because at that time I was studying a lot of criminology, so they reminded me of Lombroso, that probably they are having atavistic, body anomalies. I was told by he has passed away, that gentleman, that why don't you go and visit them once? Friends, it was eye-opener for me. When I went to see them, they were like any normal human beings, any normal women outside on the road. Dragged down, pulled down, shabby clothes, with children on laps, children with their nose flowing, children crying, women hair not properly combed. They were standing before me, and I could not think that they could ever commit crime. Gradually, I was told, when I went on doing my work, I have to establish rapport with them. I have to sit with them, much to my dislike I felt at that time. How can I sit with them? How can I get my information from them? Friends, time and again, I looked into their eyes. You have to love psychology. You have to love their symptoms. At that time, I was still a psychologist, not a criminal psychologist. I should look into their eyes and to see the pains of imprisonment. I used to see the pains of the segregation. I used to see the pains of them not committing crime and being framed for committing crime. That awakened the inner self of Shubhra in me. No, I will not withdraw from this work. I will go forward. And that's how, not 1 day, 2 days, it took me 4 years rigorously, sitting with them and studying. It often happened that I moved with Rorschach test, TAT test, self-concept questionnaire. It was very difficult to get their response. They threw the Rorschach test on my face. They threw the TAT test on my face. Then, I wondered how to get them, Every individual can become your teacher if the person is giving you the right message. Every person we must learn. We should not shutter our mind. There was an old lady in the prison who used to watch me struggling to get responses from these women. She came to me one day and she said, why do you feel dirty when they are touching you? Why do you try to shrug when they are touching you, putting their hand on your shoulder? I said, well, they look very dirty. He said, no, they're not dirty. They are harassed. They are mentally and physically harassed. They are deprived. Then she said in Hindi, and she addressed me as Beti. She said, Beti, इनके पास आपसे बढ़िया साड़ी है पहनने का. इनके पास नौकर चाकर हैं, पर ये आज यहाँ पड़े हुए हैं. आप ऐसा करो, कल से ये साड़ियां मत पहनो. I still remember when I had crossed 70 today. That lady must have passed away. आपको इनसे रिकॉर्ड लेना है, आपको इनसे रिस्पॉन्स लेना है, आप इनकी तरह बनना. कोई भी ऐसा गंदा साड़ी पहन के आएगी, तब बैठेगी साथ. Friends, I had to change my self-concept of being Shubhra, the teacher. I became Shubhra, one of the people of those sitting in their midst. The next day onwards, I used to put in dull colored clothes. I used to just, not put any powder or anything cosmetics on my face. And I used to sit in their midst. And I started unlearning all that I have learned from the book. These people became my open books. I started learning many things from them. They used to bring chola. They used to bring, peanuts, and you say eat, because that is the diet of the prison. Khao hamare haath se. I used to take them. And they started loving me and started sharing. From there onwards, my criminal psychology started. The actual psychology. Because here and there in the house, and the people, the normal people, we are seeing, we are talking and everything. But these people are not abnormal. I corrected myself. They are not abnormal. They are very much normal. Only thing, they are away from the society. You can call them as deprived, neglected, invisible, or you can, in my words, I always put them as hidden victims of the judicial system. So henceforth, I started studying them. I went on writing about them. My first paper was on self-concept of female criminals in India. That paper went abroad and made a lot of, waves. Because at that time, that was the year 1974. Many of you were not born at that time. 74, 75, I was studying and I was writing papers. And even today, when my daughter says, "So jao, raat ko 12 baj raha hai," then I realized that at one point of time, I used to sit in my Lucknow house where I was there in the quarter when I was teaching the jail officers. Till 1 o'clock, 2 o'clock, I used to go on writing with my pen and lying on the ground and writing. Because every time I felt there's something new that I can reveal to the society about these criminals. So the journey which you people mentioned, my journey, is actually the journey started from there, 1974. And from there on, after getting my award and studying and all, when I used to go into the jails, prisons, I was never hesitant. Even in the condemned cells, the superintendents and all said, "Saab, dimag kharab ho gaya, aap ladki hain, aap ja rahe hain." I said, "Let me go. I know the pains in them. अगर उनको मारना है तो मार देंगे, नहीं मारेंगे तो हम उनकी बात सुनेंगे." And I used to listen. In the condemned prisons, they used to sit quietly. They used to do pujas. They used to wait for their last day. But even then, mercy petition is then accepted all fine. Otherwise, hanging, of course, is not that rampant. But then, like I remember, I'll go on sharing cases with you. I remember I went to Jaipur jail and there was one man, small Yankee-looking man with a dhoti clad, was standing. And I was looking at his face, dark complexion, and he was just folded hands. He was doing namaste to me. He was known as Kanpati Man. A very famous story of Kanpati Man out there, Abba may be knowing. And I was aghast because my abnormal psychology had taught me that these people who are criminals, they have this type of anomalies, physical anomalies of Lombroso's theory. But there was nothing like that. So when I asked him, he said, "Nahi, maine mercy ke liye likha hai, agar mil jata hai, fine." Then, I said, "Okay," but then they didn't open him out because he's in the condemned cell, and they said, "No, ma'am, whatever you want to ask, you ask." So he said that I always had a feeling of hallucination. I felt that somebody is telling me that you go and kill this man. You go and, this fellow is there. He's about to kill you, so kill him. So I used to pick up a stone and kill. And he used to always kill near the ear, the thing. So, the fellow used to die on the spot. Next day, a dead body used to be found. With my travel, with my researches, now I realize there was some abnormality in him. He was not a normal person, though he looked normal. But at that time, there was nothing called mental illness. He was not too mentally ill. And finally, he was hanged. That was the first hanging that took place in Jaipur jail. Onwards, I went on. Then when I moved from Lucknow and I came to Delhi Home Ministry, the new forte that started with me was the juveniles. I was asked to organize courses for the juveniles, not for the juveniles, on the juveniles, for the police officer and judiciary. So I started, coining words, programming, and then came that thing, how a child learns criminal behavior. And that phase went on. It became my forte. I was teaching how juveniles learn. Like when we talk of conceptualization, cognition of ideas, child also starts learning who he is. If he doesn't have that feeling of belongingness, if he feels that he is a person who is abused, dejected, rejected, then the self-concept is injured. And when that self-concept is imbalanced and injured, then that individual personality automatically will be deformed, disorganized, distorted, dysfunctional. You can put anything there. From him, you cannot then expect that he will really, move in a healthy manner, and he will be a person who will be a law-abiding citizen until and unless there is some intervention, there is a good mentor, there is something who will wean him away from that path. I went on learning that. So while I was training the police officers, friends, while I was telling the judicial officers, let me share with you that this is a common problem existing in every home. I started feeling, not only as a psychologist, but also as a counselor, psychology and myself got so much intertwined that every moment I was speaking psychology. To the extent that my family members used to say, now you stop, you've come home, don't talk psychology. But I enjoyed, I loved, and today also I love myself. Now coming here, let me tell you that when I used to go back to my class after my courses, very senior police officers and even judges, they used to come to me and say, ma'am, when can you give us time? I used to wonder, anything gone wrong with my class? They used to say no. And then they used to sit down and share their individual problems related to their children. There came the, the spurt, you can say, of my study. I started understanding there's no retreat for me from that. Come what may, I continue to study the juveniles. These police officers and judges, they went on sharing their problems to me of the children in the adolescence, the problems they share, the disobedience they share, the defiance they share. And many of them ran away and they were brought back. So, they said how to start and where to. I should listen to them intently, friends, because psychology also teaches you to listen. I'm not a trained counselor, but counseling came from within me because I listened. I didn't butt in and say, okay, I think this should have happened because you are at fault. Nothing like that. I could understand the pains that these people had. I could understand they were having confidence in me that I will be able to come out with a solution. And when they used to go on telling me, I should listen and listen and listen. Sometimes I should tell them, see, I can intervene here and tell you. Probably you give some time to your child, try to listen what he or she is trying to say. Why are they moving away from you? Why all of a sudden they are defying you? Why is it that they are not listening to you and showing, you are trying to show your authoritarianism, they are showing theirs? Why the conflict? Why the conflict coming? And many places, these police officers and friends, I feel proud to share with you that they used to opt for classes on juveniles in an ICFS because I used to be the coach there. Another, travail, you can say, that came in my way was that when I joined the Ministry of Personal Grievance for a short period, that taught me the communication skill. I underwent 2-3 trainings, and I also interacted with undersecretaries, deputy secretaries. This was a new target group. They were not police officers, judicial officers who were doing enforced work. They were not of the part of the enforcement agencies. They were from the government sector. The problem remains the same. Again, this problem comes. I'm talking on stress management. You people all, handle stress management. I'm talking on in my own way with all new techniques. They're still stressed. So I started handling the cases one by one. A gentleman said, ma'am, the boys of today, the children of today are very disobedient, very defiant. I'm tired, These people, they don't listen how much money we spend on their education. how much hard work we do, they are very ungrateful. And immediately they not came other people, they said, yes, 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 today the scenario is changing. And this is so, instead of coming to a conclusion or accusing them, I waited for the class to break. When all were going away, that gentleman, I called him back and said, can you just individually tell me where your problem lies? Because friends, these all things I picked up when I was teaching organizational behavior. Problem. The word problem means the further the gap between expectation and result, the bigger is the problem. Parents expect from the child that whatever I give orders, you must follow. The concept of I'm okay, you're not okay. Parental ego tells the child. Now the child ego says, if I'm not okay, you're not okay. As the child is growing into middle adulthood, he says, now father, if I'm not okay, you're not okay. Now there comes the conflict. So this man said that this boy of mine at the doorstep, CBSE exam is awaiting, but he just believes in looking at the TV because the cricket game is going on. And that time, now of course there's a lot of change. I'm talking of the year 1995. Sharjah was fond of organizing cricket games just when CBSE exams goes on in India. And children loved cricket. So the boy used to see the cricket when the father used to leave in the morning. And the father used to come to the institute with a sullen face, his mind there at home, no concentration in the class. The self is divided into one self at home and the one self in front of me. So he said, how am I to manage? I said, how much time have you ever given your child to understand his priorities, his interests? He said, no, ma'am. Whatever I say, he disobeys, he defies. I said, one day, just give him one day chance. This is an experiment, friend. This cannot always be practiced. You have to see from situation to situation. But here you can see, I played the trick of the trade. I said, well, you do one thing. You just sit with him and see what he's doing. And whatever he's doing, whether you like it or not, you say, Baba, kya badhiya match kiya, kya bol mara. He started laughing. I said, sir, I'm serious. You do it tomorrow. Just do it for 2 days and then come back. So next day he tried. As soon as the boy opened the TV to see, he sat down. The boy closed the TV out of fear that the father will scold. So he said, Nani, dekho, hum bhi dekhte hain, dekho. The boy was amazed. And when the cricket was going on, probably India was playing, I have no idea at that time. He said, wow, kya badhiya khel. Well, what I told, he put it. Child said, Papa, ye to wo bol kar raha hai. He said, हाँ, हम देख रहे हैं, करो, खेलो. And there was a smile on the child's face. Seeing the smile, the father realized this is all that he was wanting, a smile on the child's face. No sooner that cricket game was over, the child closed the TV and went to his studies. In the evening, when the father returned, he said, Papa, I always concentrate on my studies. I know the time. Just give me some time to see. Because even if I sit in the class, my study room and study, my mind will be there in the TV. So you understand what I'm trying to convey? That this simple understanding, nothing more, understanding of a child's need, giving some time to the child, proximity with the child, it happens everywhere. No counseling, simply listening, and the child changed. Father was happy. He came back to me and he said, ma'am, I'm very happy. My child is doing his best. The stress is minimized. There was no very big tests and questionnaires and all therapeutic treatments and other things. It went. Why? Because I hit on the psychology of that person. Who am I? This is very, very essential. Even when people are doing in clinical psychology counseling, what are you counseling? Who are you counseling? You're not counseling the outer self. You're counseling the inner self of the person. And that inner self, Joe and Harry, if you ever have read, Joe and Harry have said that there are 4 selves. One is the private self. The other is the public self. The third is the dark self. And the fourth is the unknown self. Unknown self is the last self, which neither you know nor I know. But that remains within us. And a time comes that unknown self comes up. I start taking pen and writing books, articles, and people say, my God, can you write? That is the unknown self. So we are all involved with that process. What I was doing all this time when I was an IISM as deputy director and handling these secretaries and all with stress management, I was just flicking to their private self. Because everybody wants to cover their private self. And that was another impetus that gave to me, not for criminal psychology, but in my own psychology. And my own psychology enabled me the art of listening. And it enabled me not only to understand myself, but to understand others. It enabled me that when I'm trying to enter into another space, that person's feeling hurt, I definitely would not like that person to enter into my space. So that individual self is needed. Now, again, coming back to criminal psychology, from there again, when I returned, my criminal psychology travel started. Yes, Shreya mentioned about my drugs thing. That was another part, because again, I was all the time taking care of the juveniles and drugs. The impact of drugs on juveniles was immense. And with the NDPS Act at that time coming, I'm talking about the year 1980s, 88, 89, when I was heading the drug bureau in an ISD. The moment, NDPS Act came up, many arrests started going up. Only those who were having small amount of drugs found in them, they were put on parole. Otherwise, 15 to 20 years imprisonment, 5 years was minimum, with a fine of 50,000 was going on. My concern was children. My concern was juveniles. Lots of studies were started. They were extended to NGOs. And I was asked to, concise all the findings of the studies and bring forth to the ministry what is troubling the juveniles. And I noticed, friends, a very interesting part, that children of higher classes, children from upper homes, children from affluent homes, children who are not deprived financially, very comfortable homes, were taking drugs. They were going to affluent schools like St. Stephen's College, Delhi Public School, name any. Drug peddlers used to be there. They knew, and these people knew who the peddlers are. They knew from where to collect, and the peddlers also knew their consumers, and that's how the transaction of drugs went. What about the poor? The poor people, they were followers. They were taking cannabis. They were taking not the psychotropic substance drugs, like, charas, bhang, gaja. They were taking all these. They didn't go to high-profile drugs or sedatives. So they, I was organizing SARC conference. I went as leader of SARC conference to Pakistan. And we found, the media was there, of course, found कि जितना नहीं है उससे ज़्यादा फैलाया जा रहा है. Children were again, and parents became so protective that they were always watching that there is no symptoms that the drug is being taken, failing to understand. Again, I'll say repeatedly. The other day also I was talking in one session, failing to understand their own contribution in the growth of the child. How much time are you spending with the children? Are you noticing whether children are having stress, where the exams are concerned? In this pandemic year, when this, lockdown is going on, when the exams were uncertain, there are so many, several studies have come up where the impact of drug is felt on adolescents because they are so much under stress. How to face the exams, where to go. They are not allowed to move out. They are not allowed to move to the peer groups. So they, somewhere or the other, they are procuring drugs and taking, and the reports have come that these adolescents in the age of 16 to 18 or 17 to 18 to 20, they are taking drugs. Now, what the parents are doing? Are they understanding? Are they explaining the problems? No, because parents are under stress themselves. The very communication, friends, is distorted. The word immediately comes, तुम तो ऐसे ही हो, तुमसे क्या ज़्यादा उम्मीद करें? The short flung sentences disturbs the children further. I always, think of a word which I want to share with you all. Probably I forgot. There's a word called right. Remember this if possible, note it down. It comes like this: W-R-I-T, right, R-I-G-H-T, right. We say right. Now, what is this right? R-I-G-H-T, right. You should have the right person who is explaining things to you. You should have the right person at the right time for your communication. Right person to guide you to a particular goal. Right person to make you feel belonged and sense of love, and you will fall right at the right time. The word right, if you understand the depth of that word right, you'll understand that this is the plethora which enables or which keeps a person to his own self, one person, one self, because he always thinks right. For that, parents have to be right models, right mentors. They have to be right friends. Play a role there. Counselors play a role there. But the word right has to be there. I'm a counselor. I'm a career counselor, thoughts counselor.
We are not able to reach out to her, maybe because of the poor connection. That is how we'll wrap. That is why we'll have to wrap this session up here. But I see that there is still a lot of curiosity and questions that is there in the minds of our participants. We have received so many today. Thanks to Dr. Megha Pushkarna for taking out the time to answer those questions, and to all the experts who have taken out the time today. Thank you so much, Abha ma'am, for your wonderful insights. We have her today. We have her today, and we are going to make the most of your knowledge, ma'am. The participants have a lot of questions, and we request you to come back tomorrow. And it's a proper Q&A round, and we're looking forward to it.
Before we close, one question which Jal has asked: which journals to look at? I would like to tell you there are good journals. There's a database, Scopus, Web of Science, Springer, APA, American Psychological Association. These are database. You go and click the name of the journal, Criminal Psychology Journal, you will get a lot. So you have to be member in some of them, some are free. So please read journals which are published in these databases. They give you quality information, they give you real information, they give you scientific information. Don't look here and there journals. They don't give you right information. As Dr. Sanya was saying, right information also is important. And that's what I believe in. And we are in the field of psychology. That's what our job is, to differentiate what is genuine, what is not genuine, right? So thank you all. I really appreciate Kirti and Shreya to put this up. Good show for psychology people to understand in career in this field. And I must tell you, Kirti and Shreya, Megha, and all my faculty colleagues of psychology department, that this workshop will give students an insight and understanding and a way forward in their life to find the right career as per their need, interest, and aspirations. Thank you all. God bless you. Bye.
Thank you so much for joining with us today. We hope to see you all tomorrow. Thank you.
Thank you.